Hello, my friends. Let's see here. Whoops. Hello, good people. Hello. This is Jill Osborne, Interstitial Cystitis Network. It is Sunday, August 29th. Where the hell did summer go? Wow. I can't believe it. I mean, I'm kind of glad for it to be over. I'm ready for summer to be over. I'm ready for the cool weather of fall. But this is now our difficult time of the year, at least here in California, because of the fires. So we have fires every day, and it's daunting. All right, here. So hold on a sec. I got to see what's happening here with Facebook. Am I on the right page with Facebook? Yes, I am on the right page with Facebook. Hello, Facebook. Hello, everybody. That's some very, very interesting news to share with you. Hi, Connie. Hello, Jessica. Nice to see you. So you guys, we're live streaming right now on Facebook and YouTube. If I'm looking here, I'm looking at Facebook. I mean, YouTube. If I'm looking here, about an inch higher, I'm looking at YouTube. And if I'm looking over here, that is where my Facebook comments are. Hi, Jessica. Hello, Jennifer. Hi, Sherry. How are you guys doing today? You having a good day? I mean, it's feeling like a pretty good day. Slept well. My bladder's been very good. My pelvic floor, not so much. Holy moly. Hi, Donna. Oh, God, girl. So nice to see you. You know, as I think about my time having pelvic pain and interstitial cystitis, and I've shared this before that I'm IC subtype 3 and IC subtype 5, but when it all began, your symptoms are bladder, 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 and you're just going, okay, it's my bladder. It's got to be my bladder. It has to be my bladder. And even now, 30 years later, I still find it baffling that the symptom that we feel is frequency, urgency, or pain, even when it's your muscles. And the only way that I can, the clue that I have when my muscles are getting all tweaked down there is that I get a lot of rectal sensitivity, and I just do. I think that's because the levator ani muscles, which are the muscles that go lowest muscles that go from your pubic bone back to your tailbone, those start to pull, and I can tell that they're becoming a problem because I don't have a good urine stream. So my urine is slow, and then I struggle to have relax enough to have a nice normal bowel movement, right? And we didn't know to ask that question 20 years ago. Remember, 20 years ago, everybody was bladder, bladder, bladder. And ironic, given the fact that all these research studies found muscles so tight, they looked like they felt like tight piano strings. Hello, Corrine from Belgium. Hello, Jessica. Hi, Kelsey. Hi, Michelle. Hi, Linda. Melissa, thank you. I feel, I put a lot of makeup on. I played a little bit more, so I think I look a little pale, but anyway. Getting older, got to use a little bit more makeup these days. Hi, Joan. Hello, Kayleen. Nice to see you. Hi, Anne. Anne says, will estrace help flares with urinary frequency urgency burning? And the answer is the only way that estrace is going to help is your skin is going to immediately start using some of that estrace to produce mucus. So estrace is not a flare strategy. Estrace is a long-term thing. Remember, as you get older, or if you are in chemical menopause due to Lupron and endo, or you've had a hysterectomy, things start to dry out when you don't have a good supply of estrogen. And that includes your bladder and your urethra and your vulva and your vagina and your mouth. And so the challenge here is that and it's so fascinating, the number of women who you're prescribed estrogen, but they never explain why they're giving you estrogen. Estrogen is vital to your skin health down there. Your tissue will immediately start pulling that estrogen into the skin, where it can start producing that nice thick coating of mucus. And so many of you stop doing it, or you just never do it, or you do it once and it burns and you walk away. It's like, I'm not doing that again. That hurt too much. And it's like, no, listen, the pain that you get when you first start using estrogen is a direct reflection of the dryness that you might be feeling. So it's a direct reflection of the skin of the health of your skin. And what you're going to find is every subsequent time you use it, any heat gets less and less and less. It took about 10 days for me to cycle through that. So you kind of have to burn through it, burn yourself through it, or grind through it. You know what I mean. Christina says, you're going through Hurricane Ida. Stress from all of us has put me in a huge flare with my IC and my pelvic floor dysfunction. You know what, man? We are going to be writing books about, the stress and the effects that everybody has gone through the last couple of years. Now, listen, before I go any further, I do want to introduce myself. Hi, Shannon. Hi, Jessica. Hi, Maria. Christina. We'll get back to that. So I'm Jill Osborne. If this is your first time here, you're watching this video for the first time. I'm the longest serving IC support group leader in the United States. I've been doing this for, it's going to be 29 years next month. Holy crap. That's amazing. I can't believe it. And this is my job. So I couldn't work for my first year. So I went to college. I got a lot of degrees. I'm one of those geeks. So I've got a degree in chemistry, degree in pharmacology, drug development, master's degree in psychology, and then bam, IC hit. And overnight, things changed. I had trouble. I literally couldn't sit in a car without crying. I couldn't drive to school to do my doctorate. Yeah. I got very interested in how can I bring support to patients who are homebound. So that first, and I've shared this story, and I think it's important to share as frequently as I can. My first year of IC, I had no pain care, nothing. And I was in dire straits. I was up all night. I was sleeping on my living room floor, praying to God to help me. I wasn't flushing the toilet because I didn't want to wake my family up. God's honest truth. That is absolutely true. And I was just getting worse and worse and worse and worse, right? And there's a happy ending, so don't worry about that. I ended up at the emergency room 2 days in a row. The pain was so severe. And I had a doctor at the emergency room say to me, Jill, you will forever be a burden on your family. This is your life. Get used to it. You will always live with pain. And I went, whoa, wait a second. What? Wait. This is below the waist. This isn't above the waist. I still have my brain. I still have my heart. I still have my soul. I can still write. I can do all sorts of things. I will prove you wrong, you son of a bitch. How dare you say that to me? And that was the moment I started fighting. And I need you to fight too. I was not going to be a burden on my family. I was not going to be his implication was anybody with an IC was kind of like a waste of space. So what did I do? I went home and I started reading. Big time. I read everything I could on IC. Then I joined the ICA, the Interstitial Cystitis Association, got my stuff from them. Then I started a support group for the ICA here in Northern California. And my group very quickly became one of the biggest in the country. I had 300 people in my group within 6 months. I was shocked because up to that point, I thought I was the only person in California to have this. I found 300 literally in 2 counties. This is remarkably more common than you realize. But I was really interested in bringing support to patients who were homebound because I would do all this work for these meetings. And I'm not lying. I would drive to Petaluma. I would be crying in my car because it hurt so bad to get there. I would meet my co-leaders, Evelyn and Jennifer, at Petaluma Valley Hospital, and we would do our meeting, right? Again, driving was hard back then. And I put my heart and soul into prepping for these meetings, and yet the people who needed them weren't there. And I would call them on the phone and I would say, wait a second, why didn't you come to the meeting? And they went, Jill, it hurt too much. And I was like, oh, yeah, it does. Like, I'm not lying. I cried going to most meetings. It was like a 40-minute drive for me. That was hard. And I thought, you know what? How can we bring support to somebody who's homebound? What can we do to bring support to somebody who's homebound? This was before Facebook, guys. This was back in the America Online days. I started the first support group for urology on America Online. Started the first groups on CompuServe. I paid $200 a month out of my savings to do it. It was not cheap. And what that taught me is that the internet could be a great place for patients to gather, like we're doing right now. So you want and it was great. That first year, man, I worked with cancer patients, prostate patients, IC patients, incontinence patients, paraplegics, quadriplegics. You got it. We worked with them and developed this year's worth of data. And I thought, you know what? We can build a support center for IC right on the internet. So I developed my data. I found a doctorate at Stanford University. It's like, and it was about online support. I adapted it for IC, wrote up this proposal, sent it to the ICA, and said, I would like to build you the first support group on IC. They laughed. They laughed. They said, no one will ever use the internet for support, ever, ever, when they can pick up the phone. And I was like, listen, did you read my data? And they went, no. And I went, look when people are using it. People are using it in the middle of the night when they can't pick up the phone. This could really work. And I'd like to get my doctorate. So I'd like to do this for you. And they said no. They flat out said no, gave me a lecture on knowing my place. And then they threw the gauntlet down and said, we will never, ever recognize your work. If you do it, don't expect anything from us. We will not do it. And that is the day that the IC network was born. And now 28 years later, I am extremely happy that we have been rated #1 by Harvard Medical School and the University of London for what we do online, because the goal here was to give you a resource center where you could come and get information. Now, of course, a lot of things have changed. You know, back in the old days before Facebook, we had 200,000 patients a month on our website in our message forum. And now people are spread out, and that's okay. There, you got people on Facebook, you got people over on Reddit, you got people on Instagram, you got people on Twitter. They're all over the place, and that's fine. You know, I didn't take it personally that people went to other places, because everybody needs a home, and I'm not the right fit for some people. Some people don't like the way I do things, and that's fine. And some of you do, and that's fine. The more, the better. We have millions of people with IC, and the more of you who can find support in whatever format works for you, that is important, and that is great. You just have to understand something we didn't know back then, and that is that you're not all the same. Not everybody has an incurable bladder disease. We don't. We don't. There's diversity in this patient community. And the challenge with any support group, and this is what I dealt with in my real support group that I ran here for more than a decade, as well as the IC network, is that newbies have very different needs from a grizzled veteran. And somebody who's newly diagnosed, they need to come into a support group and they need to get good information. They need to get hope. They need to get encouragement. They don't need to be scared. Grizzled veterans, on the other hand, especially those of you who might have had symptoms for a long, long time, you have your own needs. And we need to make sure that you have the support that you need too. But sometimes y'all don't meet in the middle this way. And it gets really difficult when you've got a Hunter's lesion patient with a severe viral infection in their bladder as compared to somebody with pelvic floor dysfunction in the same group. Because that person with the pelvic floor injury is going to look at that patient with a Hunter's lesion crying her eyes out going, oh my God, I don't want that to happen to me. And the answer is, it's not going to happen to you. It shouldn't happen to you. So it's hard to get context in an online support group. And that's my job when I do these meetings, is to give you a little bit more context. All right. Now, normally when I do these meetings, I do a little 30-minute intro, and then I take your questions, and then we might do Zoom. We'll see. But I do have 3 interesting things that I want to talk to you about before we start our Q&A. Last week, we talked about COVID-associated cystitis, right? So now we know there is a real medical condition that happens in people who get COVID. And there's 2 theories as to what's happened. We've known this for a year. I see patients who get COVID. Some of you report severe flares that last for months. I'm not talking about the vaccine. I'm talking about COVID. Why does that happen? There is something called a cytokine storm, where in response to the virus, the body puts out a massive, destructive inflammatory response. And that damages tissue. And that's what causes people to have so many lung problems and have difficulty breathing and to have migraines and all sorts of other stuff like that. But a lot of those inflammatory markers end up in your urine where they irritate the bladder. They irritate the bladder. So we're getting a cytokine storm in the bladder also for patients with COVID-associated cystitis. The other thing that we know is that COVID virus is actually in the urine of patients with IC. I mean, urine of patients, not with IC, with everybody who has COVID, that they're basically finding live COVID virus in urine. So a paper across my desk this morning, actually, as I was getting up this morning, I usually read all my email, and it was about men who have had COVID who ended up with erectile dysfunction, like really significant erectile dysfunction. And when doctors went in to try to figure out what was happening, what did they find in their penis? Any guesses? COVID virus living in the penis. Okay. And this is a point you have to really understand here. The COVID is not a respiratory virus. It does far more than that. It is a circulatory system virus. Once it enters your body, it gets into your blood vessels and it goes everywhere. And for men, they're finding live virus contributing to erectile dysfunction. And so if you have any men in your life who don't believe in vaccination, this is important information for you to give to them. And I would be happy to give you the reference to that. So we are in uncharted territory, and we are all living through a great tragedy in what's happening right now. And all I can tell you is that you have to take this very, very seriously and try to protect yourself. All right. So again, we have COVID-associated cystitis now, and there's more research on that. The research is being done at the top IC research center in the country, which is Beaumont Health up in Royal Oak, Michigan, along with a couple of other universities. There is no doubt there are about a dozen publications. It's there. We also now know that the virus can contribute to erectile dysfunction. And that makes sense because, we know that the virus causes blood clots, and an erection is all about blood supply. And so now we know that they have limited blood supply because of the virus. Okay. I'm so sorry that we even have to talk about this right now. It's just awful. But anyway, that's all I'm going to say. Just planting that seed. For God's sake, be safe. Do everything you can to protect you and your family. This is not the time to travel, et cetera, in my opinion. You got to hunker down. We will get through this. Okay. The other thing that crossed my desk today was, surprise, surprise, a newly published diet for overactive bladder. And it was done by the European Association of Urology. It was done by one of the really credible groups. And it was interesting because they made a mistake in it. The very last line that they wanted people to avoid was vitamins buffered by artificial sweeteners or aspartame. It's like I emailed them and said, no, let's fix that. So overactive bladder are patients who have frequency, urgency, and incontinence. And there's a real key difference between somebody with IC and somebody with overactive bladder. And it's all about urgency. Why are you running to the restroom? You are running to the restroom to reduce pain. That's interstitial cystitis. That means the C fiber nerves have been turned on. If you are running to the restroom because you feel like you're going to leak, that is overactive bladder. That's the difference. IC patients really do not struggle with any serious degree of incontinence. Overactive bladder patients do, and that's because there might be some neurological things. And of course, some people think that overactive bladder is a mild form of IC, and parts of it might be, and parts of it might not be. I'm sure we're going to be doing subtyping with overactive bladder too. Okay, so and then just an update on our book, IC 101. I've spent the last 10 days trying to get it listed on Amazon, and they have a problem with people interpreting ISBN numbers. I thought I had it done last night. I checked this morning. It's still not done. So if y'all want our book, our new book, IC 101, it's not just a bladder disease. You have to get it from our website. We will figure it out eventually. I'm actually getting help from Amazon, and they're not. This is very common, apparently, what I'm going through with this. But I will get there, I promise. And what is that? What was that noise? Okay. All right, so that's all I need to say. Our magazines are out. IC Optimist, our members, go to your member page. You can download our summer IC Optimist magazine. We're already working on our fall IC Optimist magazine. I will be IC. Oh God! And then the most important thing of all is IC Awareness Month. It starts on the 1st. IC Awareness Month. So this is the month. Let me give you just a wee bit of history on IC Awareness Month. It was originally IC Awareness Day. It was done by the original ICA that was based in San Diego, and it was in November. And then they switched it to a week. This was like 15, 20 years ago. Then they stopped doing it, and the company that made Elmeron started doing it. They moved it to October. And they had a week, but they only promoted Elmeron. They didn't really do any IC outreach. Then they stopped doing it, and then we took over. I waited a year to see if the ICA was going to pick it up. They didn't. So we picked it up, and we did IC Awareness Month. We moved it to September after a vote because there were too many things happening in October, especially breast cancer awareness, and we couldn't compete. So IC Awareness Month is from September 1st to the end of the month. And this is a time where you get to speak out. IC Awareness Month is not about me. It's not about ICA. It's not about the IC Network. It's not about any national group. It's about you. It's about your community. It's about you looking at your community and asking yourself, are they treating IC patients fairly? And if they're not, what are you going to do about it? What are you going to do about it? So what we have over on IC Awareness is we have a lot of resources that you can do. We have posters, we have press releases, although I don't have the current press release up yet. I'll have it up tomorrow, that you can send to your paper. You can tell your story. You can call radio shows. And I realize it's going to be subdued this year because of COVID, and that's okay. It's okay. Just speak out about it when you can. Put it on your Facebook page. Put it on your social networking. We have daily awareness facts, and we will put those out on all of our pages as we do every year. And so just do your best to try to talk to people about it, okay? And next year will be better. Next year will be better. All righty. Is there anything else? No, I don't think there's anything else. All right. So let's take your questions. Are you going to challenge me today? I want to be challenged today. I'm in a good mood. I hope you're in a good mood. Let's hang out together. Let's support each other. Let's comfort each other. And let's see what we can do to give some patients hope, because there's a hell of a lot of hope out there that we didn't have 20 years ago. It's good, you know. Jennifer says, what do you recommend about InterStim? Does it help with symptoms altogether? Well, let's talk about InterStim for a moment. So we have, back in the old days, 10, 15 years ago, it was like the wild, wild west of IC. Doctors around the country were treating IC in many, many different ways. Some doctors were saying there was no treatment for IC. Other doctors were saying the surgery was the only therapy for IC. Other doctors said it's hopeless, it's incurable, which of course we now know is ridiculous. And so the American Urology Association back in 2010 convened a panel of experts to create a diagnosis and treatment model that they wanted every urologist and every doctor to use so that we had consistency, right? Because I'm not lying. I had some people who were told IC was not real. I had other people. I had one lady who was committed to a mental institution when she was diagnosed with IC. And the mental institution let her out within hours because they were wrong. Okay. So today we are doing a more standard protocol. So we have 6 steps of therapy, right? So step number 1 is all the self-help stuff. It's diet, it's supplements, it's relaxation, et cetera, et cetera. Man, it's making sure you're drinking plenty of water. Yeah, if you're not drinking water because you're afraid you're going to pee all night, that's a mistake because you're actually going to make it worse because you're going to make your urine a lot more concentrated. Our second round of therapy is going to be oral medications, bladder installations, and physical therapy. Our third step of therapy is Hunter's lesion therapy. Our fourth step is going to be either Botox or neuromodulation, and that's ankle stem, urgent PC, or interstem, which is at the pudendal nerve or the sacral nerve. That's a surgical procedure. IC treatment 5, step 5 is cyclosporin, and then step 6 is surgery. The reason they're in steps is they're rating it with respect to the risk of adverse event. They don't want you to do anything dangerous or harmful until you do the easy stuff first. It's shocking to me, some of the patients out there, and I was working one on Friday, who was still drinking a lot of soda every day, and yet she had already gone through step 2, the bladder instills, everything. She'd gone through step 3. She was at step 4, and I said to her, here's the problem. It's not going to work for you as long as you're drinking soda. No therapy can counteract the damage done by a strong acid every day on your bladder if you're IC subtype 1 or IC subtype 2. And she's like, oh, yeah. So really, the foundation of your care is self-help, what you do at home. Because if you're not making the right steps at home, you're not going to get better. You're not going to get better. We have to create an environment that will support healing. Okay, so anyway, I know I kind of went through that fast. It's called the 6 Steps for Treatment. They're from the American Urology Association. I have a video of it on our website, on our Facebook page. You can go watch the video for an in-depth discussion. So let's talk about neuromodulation. So neuromodulation involves using a little electrical impulse to try to re-regulate or calm the nerves that might be controlling your bladder. It was invented at UC San Francisco, where I happened to be the support group leader, actually, when it was invented. And the name of the doctor who invented it was Dr. Richard Schmidt. And what he was trying to do was to calm these nerves. And so what they did is they operated, they put leads into the nerve by the spinal cord, and then they attached the equivalent of a TENS unit to it. And there was a trial. So in the trial, they put the leads in, so they have to do an incision, put the leads in, sew it up, and then they would give you a little waist pack with your TENS unit. You'd wear that for 2 weeks, and we'd be looking at your frequency, urgency, pressure, pain to see if it made a difference. If it made a difference, then they would consider doing the surgical implant. Instead of you wearing the belt, they would make an incision on your upper butt, and they would make a little pocket underneath the skin by the muscle and put the transmitter there. The early days were awful. Awful. I witnessed it. I cannot think of a single patient who had anything good to say about Interstem back in 1993 to 2000 because they didn't use enough anesthesia. Imagine having surgery to put leads in with no anesthesia. That's how it was back then. And in fact, I went to the company, Medtronic, representing them. They flew one of their people out, and we went through all of our problems with what was happening back then. And they addressed that. They started anesthetizing people. Like, duh, of course you anesthetize people. Eventually, the data was pretty good. It did show a measurable improvement in frequency urgency. However, at the same time, the challenge with Interstem were just a massive number of complications that are still happening today. Jennifer, these are still happening today. Anytime you do surgery, you run the risk of infection. And so the number one side effect of Interstem is a deep tissue MRSA infection at the generator site. And I read a report from a doctor who filed a complaint with the FDA, and I can show you how to go to those complaints. He said the problem with this area and the reason why this is happening is because it's of its location on the skin, that you have inherently a lot of bacteria on your skin down there because of its proximity to your tush. And that may be one reason why so many patients appear to get infections. The other challenge with the device is that in the old days, it used to move a lot. The leads used to, I had a girl in actually, it was my co-leader, Evelyn, who actually had it done. And literally when she went to sit in her car afterwards, the lead moved and stopped working. And then her husband ended up pulling it out of her body, which is crazy. Crazy. We love Evelyn. Evelyn has left us. Evelyn passed away from cancer several years ago. But anyway, her experience was really palpable. Also, the device could malfunction. It would shock people if you went through a security door, or if you had to go through an airport and go through a wanding phase. In fact, if you have InterStim and you're traveling, you have to carry a card with you so that if you do go to an airport, you can step to the side, produce the card so that they won't wand it and potentially turn it off or on. I had one of our members who every time she had a bowel movement, it shocked her. Like she was terrified to have a bowel movement because it literally shocked her. Can you imagine being shocked down there? It was awful for her, absolutely awful. Her doctor told her that was normal. Well, she called me and I went, "That's not normal." We did a conference call. I got the company on the phone line, told them, they went, "That's not normal. Holy hell, that's a malfunctioning device." And they gave her the information that they needed to go back to her doctor to fix this because that was ridiculous. It should never hurt. There shouldn't be a therapy out there, no matter what you're doing, that it gives you more pain than the IC itself, right? I mean, that makes sense. So while InterStim is FDA approved for overactive bladder and frequency, urgency, incontinence, and that's really where it can be very, very successful. If you have somebody who is bowel incontinent or bladder incontinent, InterStim can absolutely change their life. But it is not approved for interstitial cystitis, nor is it approved for pain. They just cannot make that claim. They cannot make that claim because the research does not support that. Your doctor might say it helped some of his patients, but it's not approved for that. And it doesn't work that way for everybody. So what was interesting is while this was happening at UC San Francisco, and you had these patients who were screaming in the exam rooms as they were doing these trials without anesthesia, another doctor there, Marshall Stoller, was just quite frankly appalled. He was stunned. And he said, "Guys, you don't need to cut somebody open to reach this nerve. The nerve goes down the legs. It actually goes down by the ankle where it's about a half an inch from the surface of the skin. So you don't have to cut somebody open to access this nerve. You can use a simple acupuncture needle to reach that nerve." And he created a different neuromodulation which today is known as urgent PC. So rather than doing two surgeries, because you have to have the surgery to have the leads put in, you got to have the surgery to have the device put in, generator put in, then you have to have the surgery to pull it all out. There's a hell of a lot of surgeries. It can be very, very expensive with InterStim. Whereas with the urgent PC, there's no surgery at all. It's just an acupuncture needle stuck into your ankle with a TENS unit attached to it. And I just pray, I'm so thankful that when I was referred to UC San Francisco, I ended up in his clinic rather than the InterStim clinic. And I can show you, let's see. Can you see that little black mark right there? See that little black mark? That's where they put the needle. So we put the needle in. Actually, we ended up, you kind of go down and you go down like that. It's not straight in. Did that 30 minutes, 1 day a week for 10 weeks. By week 3 or 4, I had my first 2 hours without pain. Remember that doctor who said I would forever be in pain? Yeah, he was wrong. Because guess what? Urgent PC broke me out of that flare. By week 4, I had my first 2 hours without pain. By week 7, I had my first day without pain. And so there's validity here in wanting to calm the nerves down. When you've been in pain for a long period of time, your central nervous system is involved. Yeah, your nerves are involved and they are reacting. Anything that we can do to calm those nerves down make total sense. And so doing the ankle stem is certainly preferable to doing the surgical implant. The surgical implant comes with really serious risks. You can find those. You can find hundreds, if not thousands, of adverse event reports related to InterStem at the MAUDE database. Remember the old TV show MAUDE? I know some of you are too young. MAUDE. Google MAUDE FDA database and go search. Make sure you go back 2 or 3 years or go back a month and just look at all the cases reported this month. There are tons of adverse effects with InterStem, very, very few with urgent PC. Last but not least, if you are considering neuromodulation and you are considering InterStem, I want to share one story with you. There was a nurse in Appalachia, I think she was in Virginia, somewhere like that, who had IC. She lived in a small town, 3 urologists in town. Every single one of them said, you have to have this done. We will not provide any other care for you until you have the InterStem done. And she was like, I don't really want to do it, but if that's what you're saying, I'll do it. But she was pretty savvy. So she asked the billing employee at the doctor's office, is this covered by insurance? They said yes. She called the hospital. Is this covered by my insurance? And is any written pre-authorization required? They said, you're absolutely covered. We don't need anything. You are good to go. Then she called the insurance company. She called the insurance company and said, is this covered by my health insurance? They said, yes, absolutely. You're fine. A week later, she had a bill for $85,000. It had been denied, and they threatened to garnish her wages because she was a nurse at the hospital they did it at. The mistake she made is she didn't get it in writing. So do not agree to have InterStem until it is in writing in your hands that it is covered by your health insurance. And then the other thing to think about is, and this is an important question to ask your doctor, is, will you cover this if I lose my health insurance? Because InterStem requires constant coverage. It's got to be checked regularly. And we've had a number of doctors abandon patients. Literally, abandon is the right word. They just fire the patient. You don't have insurance anymore. We can't treat you anymore. Here you've got a patient. I had a patient in Florida, malfunctioning InterStem. It was shocking her all the time. Doctor refused to see her because she'd lost her health insurance. She was on Medi-Cal. She calls me sobbing, I don't know what to do. We call the company. And it's like, guy, this is your fault. This is your device. Fix it. Help her. There was one doctor in the entire state of Florida that would see her as a Medi-Cal patient. And here she's got a device that is physically harming her, and they would not care for her. So that other important question to ask your doctor is, will you see me and care for me if I lose my health insurance? And if the answer is no, then you're going to say, then who's going to help me? And if he says, I don't know, you're going to say, then I don't know if I want to have this right now. I need assurances this is going to be covered. This is operating metal in my body. There are issues here. There are issues here. All right. So InterStem is one of my bugaboos. All right, so you guys on Facebook, your questions are scrolling by, and I know I missed a bunch of questions, but let me just go through these. Thank you, Jessica. Jessica says you're our poster child. I have a poster old lady now. Susan says, I use estradiol cream. Takes a while, but works. Yes. Hi, Callie. Jenna says, any suggestions for sleeping better? I'm up 4 times a night on a good night. It's been okay during the day as long as I watch what I eat or drink. I take hydroxyzine, Cystomen, Desert Harvest Aloe. Been trying CBD oil. I took amitriptyline years ago. It didn't do much. The problem with sleep has been for about 2 years. I've had IC for over 30 years. Diagnosed about 20 years ago. My urologist wants to do installations. Should I give it a try? Well, number one, you got to remember, I'm not a doctor. I can't give you medical advice. My job is to open doors, open windows, give you as many things to think about and talk to your doctor about, right? In other words, I got to educate you and then kick you in the butt and get you back to your doctor. So, Janice, you raised a couple of really important points here. The first thing we really have to consider is, what is your subtype? What is your subtype? Because if you have IC subtype 1 Hunner's lesions, then the reason you're up at night is because your lesions are active and they probably need treatment, right? If you have IC subtype 2 bladder wall driven, and that's from chemical injury, estrogen atrophy, or chronic UTI, then we have to kind of dive deeper into which one that could be. As an example, the patients who, nighttime urination is usually a direct reflection of something that's happened during the day. And again, the woman I was working with on Friday, Sweetie, with severe estrogen atrophy, she had very severe estrogen atrophy, was drinking a cup of coffee every morning. And as I explained to her, the patients who suffer the most and the patients who really will never get better are the patients who do that. 1 cup of coffee a day, 1 soda a day, because you are physically destroying the next generation of cells that are trying to heal your bladder. The bladder is the slowest healing organ in the body. It has the largest single cells in the body. They are giant cells in your urothelium. And if you look at it under an electron microscope, it looks like a beehive. They're hexagons, and they have very tight junctions. They really fit tightly together to prevent anything getting through. So imagine an extra large pizza, and then imagine a single green pea underneath that pizza. The pea is the stem cell. So this year you got this big giant urothelial cell that has been damaged. Because, hello, guys, the bladder can be damaged easily, just like any other part of your body can be hurt. So let's say you're going through chemotherapy, right? Or you're drinking a hell of a lot of diet soda. The chemicals in that are going to slowly damage some of these cells. So now you got a broken cell. It takes 2 weeks for that little tiny stem cell to grow and change and fill in the missing link. Fill in the missing hole, right? And it was at a National Institutes of Health IC meeting and a lecture by Dr. Anthony Schaefer, who was talking about how the bladder repairs itself. And he said that this new stem cell that's trying to repair the damage is exquisitely vulnerable. It will literally be destroyed by a strong acid, like a cup of coffee or soda. And so at that time, he was like, this is why diet moderation is important, because we don't want to interfere with that healing process. And for all of us, who were support group leaders, we had an international team there. We were all looking at each other going, yeah, of course. The patients who suffer the most are absolutely the ones who drink a cup of coffee a day or a soda a day, because you're literally destroying your next generation of cells every single day. You will never get better. The bladder cannot repair itself if that's what you're doing. So this lady that I was working with, she was like, you mean I can't do it? And I went, no, you can't do it. She goes, what about low acid coffee? And I went, if you had an open wound on your hand, would you pour low acid coffee on it? And she goes, no. And I said, then why are you doing it to your bladder? She goes, what if I put pre-leaf in it? I went, okay, if you have an open wound on your hand, would you put coffee and pre-leaf on it? She goes, no. And I went, duh. Of course not. I didn't say duh. I'm nicer than that on the phone. But, duh, no. This is about creating an environment that will support tissue repair. We have to help that tissue heal. So again, nighttime urination is often the result of something irritating during the day. So, and it might be something that you think is completely innocuous, because the other thing she was doing is she was taking a mega multivitamin every day. And we don't do traditional multivitamins well. We don't, because they use ascorbic acid, which is a really strong acid that's going to hurt your bladder. We can do Bladder Smart, which is a nice low acid multivitamin. That's what I take, but I have flared every time I've tried to take a regular multivitamin. Okay, so things happening during the day. Now, another question that's worth asking, Janice, is, are your symptoms positional? Is there a different position that you can sleep in that isn't as painful or isn't as uncomfortable? So if you sleep on your left side or your right side or on your back, do you notice any change in your symptoms? Because if, for example, you have pain not in your bladder, but to the left or right, a center of the bladder, then you might actually have a muscle nerve issue going on at night. I had that. I have that sometimes on my left pelvic floor muscles. They squeeze a nerve and they push on a nerve if I'm laying flat on my back, which I have to do because I have freaking TMJ right now. With respect to installations, we still have to kind of go back to your subtype, right? We have to try to understand your subtype. But if you are generally, I see subtype 2 bladder wall driven, then doing an installation kind of makes sense but it depends on the type of installation. If it is a rescue install with heparin and lidocaine, that's not a bad idea because the lidocaine will turn the nerves off in your bladder and the heparin will coat your bladder. And so that would be interesting. But you guys, you never, ever, 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 no, really ever let anybody put anything in your bladder without them telling you what it is. This is about informed consent here. If a doctor says, hey, let's do a bladder install, your proper reaction is going to be, what would you like to put in my bladder? And if they say, oh, just an installation we use, and you're going to say, no, I want a little bit more. Are you proposing to use heparin? Are you proposing to use DMSO? Are you proposing to use chlorpactin? Please tell me what you would like to do to my bladder. And if the doctor says, hey, man, I'd like to strip your bladder with chlorpactin or silver nitrate, you're going to say, oh, hell no. No, it's not in the treatment guidelines for IC. We don't do that anymore. We haven't done that for 15 years. And yet there's still a doctor in a military hospital in Texas who was doing it, like as recently as 2 years ago. This poor girl was in the hospital overnight, and they did a 24-hour infusion of ever-increasing doses of silver nitrate. And she was a screaming lunatic afterwards. It hurt so bad. We don't do that anymore. If the doctor says, hey, I'd like to do DMSO, your answer is going to be, well, I'd like to read about that a little bit more first. What do you propose to do with DMSO? Come on. No, you can't be passive here. You got to be active. You got to be informed. Also, I do have a couple of articles on our website on sleep quality too, melatonin. There are other things you can do. Hydroxyzine, taking at dinner time can definitely help improve sleep quality a little bit. Amitriptyline, the antidepressants, they might make you a little bit more drowsy, but they definitely have a few more side effects, dry mouth, dry eyes, cognitive issues. So you might also want to even consider palmitoethanolamide, PEA, Peora, which is an over-the-counter supplement, which helps to calm nerves down. And that's what I do. I use Peora. All right. Jessica says, some of my best friends were found in the early IC groups in 2003. Yeah. Isn't it great? I mean, it's to have so many of us back then who are still friends today. It's amazing. Nancy said, let's see. Can you see hunters on a regular cystoscope? And the answer is no, unless it's something called a narrowband imaging cystoscope. There's only one type of cystoscope that can see Hunter's lesions, and that is called narrowband imaging. And that does not require anesthesia, and it can work really, really well. And so ask your doctor if they have a narrowband imaging device. If they do, you're gold. Shannon's going to the urologist tomorrow. Hi, Diane. Shannon says, I'm thankful when you had COVID in January, you had no IC flare-up. Oh, honey, I'm so thankful for you. Lisa says, I've been a flare on and off for many months from taking Cipro. How do I heal? Detox flares me. I'm eating really clean. Can vaccine cause food sensitivities? Well, so number one, your body, the human body is wired to heal and repair itself. You have to understand that. There's nothing you can take that's going to heal it. This is about creating an environment that will support the healing of your bladder. So there are some antibiotics that act as chemical irritants to your bladder. The most common one is Augmentin, but it wouldn't surprise me if Cipro irritated your bladder a little bit. But any of the damage that the Cipro did back then, I would assume should have healed at this point in time, unless you have been poking and prodding at your bladder by not following the diet. You say detox flares you. There's nothing to detox. You guys, detox protocol, please do not do detoxes. For everybody out there, you don't need to do any sort of weird detox or coffee enemas or anything like that. We now believe that those do more damage than good. But it does raise a very interesting question, Lisa, and that is because you did take Cipro, is it possible that you now have a candida infection in your urinary tract and in your bladder? Why do I say that? Because our own National Institutes of Health discovered it in their IC research about 6 years ago. The MAP Research Network, which is our big multidisciplinary research team that's been functioning for about 10 years ago, the MAP stands for the Multidisciplinary Approach for the Study of Pelvic Pain. They're doing the premier research, best research in the world is being done by our government, funded by our government. And they were the ones who found that many patients who were flaring because you had yeast in your bladder. And we've been talking about this for about 6 years now. If you flare when you eat sugar, if you flare when you have carbs, the odds are you probably have a candida infection, or you could have a candida infection. Or if you were like the rest of us, took a lot of antibiotics back in the old days, you also could have changed your biome so dramatically that you now have systemic candida, maybe in your gut and your urinary tract. And of course, the challenge here is when here you've got, imagine, you have all the symptoms of a terrible bladder infection. You go to the doctor, you're crying, please, doctor, help me. My bladder is on fire. They test your urine, it's negative. And they go, we're sorry, you don't have infection. They didn't test for the right infection. A typical urine test does not test for fungus. It does not test for candida, guys. You have to ask. And that's when a next generation DNA urine test really can be helpful. So if you go over to our website, icnetwork.org, and you just do a search for candida, you can find the research. This is not a crazy lady on the internet telling you this has happened. This is our own National Institutes of Health who made this discovery. So that's what I would want to know. At this point in time, since you were on Cipro and this began after Cipro, it's time for a next generation DNA urine test. And let's see if you have fungus. You could. Anybody who wants to learn more about next generation DNA urine testing, go to bladderhealth.org, bladderhealth.org. That was a website I built a couple years ago, and it has a bunch of videos of doctors who are using it. But there are pros and cons with it. All right, so you guys, Facebook, you're moving so quickly. I just missed some. If I missed your question on Facebook, please don't take it personally. Just ask it again. Be the squeaky wheel. Ask over and over and over. Somebody said, are rescue installations the same as 6 week? Rescues are usually done once a week for 6 weeks, 6 or 8 weeks. Jennifer says, I got vaccinated for COVID as soon as I possibly could, and I got the second vaccination a month later. Yeah, me too. Pfizer worked fine. Michelle says, after her pull-ups all day and all night. Uh-oh. Why? Are you leaking that much? If you're leaking that much, we have to try to figure out why you're leaking so much. Is it because you have very weak muscles, or is there a neurological problem? Jennifer says, are there any wildfires near us? There are fires every day now. The nearest, we had a fire within a couple miles 3 days ago. But the fire, I got to say, all props to CDF and our fire departments. They are on it. But it's very hot. It was 106 here yesterday. The wind was blowing, very, very smoky, and I was on tenterhooks all day, and all night last night. I don't sleep a lot during the fall. Jessica says, I haven't had a hydrocystosis since 2003 when I was first diagnosed. I felt the more they leave me alone, the better I've been. My IC is getting amped up again, and I wonder if I should do one again. Well, Jessica, I have a theory here, and my theory here is that I don't like people guessing about me. I kind of like facts. And if I'm in pain, I want somebody to look at it. Seriously, I'm not gonna, if I'm in pain or I'm bleeding, I want somebody eyeballs on the organ. If I were peeing blood, I would want somebody to look in my bladder and tell me what the hell is bleeding. And so I am all for letting somebody look, because we're taking it out of guessing. If you don't let somebody look, you're forcing them to guess what's wrong. And that doesn't necessarily get us where we need to be. Because if, for example, you have Hunner's lesions and we want to make sure we get those lesions treated, or if, for example, you have that done and you come out and they say you got a baby bladder, your bladder looks great, that's really important good news here, because now we have to look outside of the bladder for what could be triggering this. The other thing to think about, Jessica, and this is true for every woman, if your symptoms start getting worse as you get older, you have to consider estrogen atrophy. That's often the missing link, the quality and health of your skin. Your skin is going to change as you get older. Your urethra, your bladder is going to change as you get older and estrogen drops, and you're going to be more vulnerable. Jacqueline says she's flaring bad. I'm sorry to hear that, hon. I'd love to try to help you. Maybe when we start the Zoom meeting in a half hour, you can come in and we can talk about it. Lisa says, I've been in a flare. Oh, wait. Oh, no, hold on. We already did her. Lola says that she's addicted to a medication, that she can't live with this condition without pain meds. All right. So Lola, you are, it's very, very important that we subtype you. We need to know what's screaming in pain. Is it Hunner's lesions? Because if it is, we can treat Hunner's lesions, and Hunner's lesions respond beautifully to lesion therapy, and the pain can drop dramatically, so you won't have to use, right? Or is your pain because you have a fibroid tumor pushing on your bladder? So, or is your pain the result of endometriosis on top of your bladder? There are any number of things that can be causing severe bladder and pelvic pain. And you guys, you all have to, yes, the pain is agony. For some of, I've been there, I understand. And it's very hard when you're feeling like crap to be an advocate, but you always have to bring it back to, doctor, please tell me, help me understand what's hurting. Why is this hurting? What can we do to treat it? Because when you focus on treating the cause rather than the effect, you earn their respect, number one, but you have a really good shot of getting better. Lola, I will make this offer to you. If you want to call me this week, I would love to talk with you. Let's see what we can do to try to get a little bit more clarity as to what could be triggering your pain. And I would love to try to help you, my dear. I really, really would. Anybody who wants to get a hold of me, you do it through our website, icnetwork.org. My email address, super easy, icnetwork@mac.com. So Lola, I'm serious about this. I would really love to talk to you on the phone and try to help if I can, and maybe refer you to another doctor or a better doctor. Jacqueline is looking for doctors on our database. On our website, we have a database of doctors. I also have another database from Harvard Medical School that I go through at the end of the meeting, and I can give you more specific referrals. Kelsey has a very good response to Lisa. She says, I would double up on probiotics, taking collagen to feed your gut, restore the healthy bacteria. Cipro is very, very strong, can wipe you out. You may also be clenching muscles out of pain and inflammation, so try some relaxing stretches. Yeah, agree. Tammy says, I'm pretty sure it was the late 1980s when I spoke with you on the phone, Jill. You've always been so sweet and helpful. Thank you for everything you've done. I could write a book on everything doctors have done to me since my IC started. It's definitely been a long, hard journey, girl. I got it. Terry said, I would love to have all the information on this. I was diagnosed a year and a half ago. Girl, largest archive of IC information on our website, icnetwork.org. Go on over there. I always forget that some people don't read the website. You know, you got to go to the website to get the facts here. Oh my God, Terry. Holy hell. Oh, you guys know, bear with me if I swear a little bit. I'm sorry. The stress of the last year, it pops out and it's okay. I'm 61 years old. I get to do that now. All right. You guys, this is so important. You got to let me read this. Terry says, I would love to have all the info. I was diagnosed a year and a half ago. My urologist told me to go home and take Tagamet. I never got relief from that, never total relief. I flared really bad 3.5 weeks ago. I called the urologist, was told to go to the emergency room with my pain was at a level 10 because there was nothing else we can do. I called the OBGYN here who prescribed bladder installations. No one has ever said anything about diet. I have been drinking 5 to 6 diet peppers a day. Oh my God. Oh my God. Oh my God. You guys, you weren't just drinking the worst soda with respect to acid level. You were drinking the worst form of that soda, which is diet Dr. Pepper. You know, patients over the years, when they've talked to us, Dr. Pepper is renowned for causing flares. And the problem with the diet is that NutraSweet, and I just did a big article on this in the last couple of weeks, we now know that NutraSweet, aspartame, is directly related to cancer. Why? Because it's broken down into methanol. Methanol is a wood alcohol. Thousands of people die every year from ingesting wood alcohol. Then the methanol is broken down into formaldehyde. That's a pickling agent. I mean, no, it's worse than a pickling agent. It's formaldehyde. They store dead bodies in formaldehyde. I've worked with formaldehyde. I did a surgical internship that involved operating on animals that have been stored in formaldehyde. Oh my God. Now we know formaldehyde is a byproduct of NutraSweet, aspartame. And then formic acid, which is a really, really strong acid. So guys, if you got to have a soda, I went 10 years without a soda. And then I got real sick and I had a 7-Up. And then honestly, the other night I had a root beer. Root beer is, if you can find a nice old fashioned root beer, like A&W root beer, that's the best soda to do. But I'm talking like one a month. That was the first root beer I probably had in 20 years. I'm not lying there. But they're naturally caffeine free and very low in acid. So a root beer, okay? Rita says, do I know of any group in Mexico? Yes, it's called ACI Mexico. It's run by a lady named Florentina. And if you go into our website, into our support listings, we have the international listings, and you can find the contact information for that group over on our website. Terry says, yes, NutraSeed is terrible. Yes. Olivia, I've had IC for many years, had a recent return of eczema, which you had as a child. It's been causing severe itching, all sorts of health issues. Was wondering if anybody has tried Dupixent. Hoping if I try it, it does not increase IC symptoms. I've never had anybody call me to say that they flared from that medication ever. But let me take a look at let me take a look at it here. So it works by targeting a protein called interleukin that is involved in inflammation. It calms an overreactive immune system, but it does not suppress the immune system. Well, that's encouraging. Let's see what the side effects are. You want a pharmacology geek term? I should make this required for our giveaway today. Uh, it's an interleukin for receptor alpha antagonist. Okay, so the side effects are injection site reactions, pink eye, swollen or puffy eyelids, oral herpes, canker sores, inflammation of the cornea, eye itching, other herpes simplex viral infection or dry eye. And it can interact with live vaccines, warfarin or cyclosporin. Hmm. Call your doctor if you have worsening eye pain, vision changes, watery eyes, eyes more sensitive to light, feeling like something is in your eye, blood vessel inflammation, fever, chest pain, trouble breathing, skin rash, numbness. Hmm. Well, it doesn't say anything about the urinary tract, Olivia. Terry says, as a diabetic, the artificial sweeteners have been my go-to along with the diet sodas. Yeah, Terry, unfortunately, and that's why we have a lot of diabetics who struggle with urinary issues is because of all the artificial sugar. I mean, it would just be better to, the problem is that the artificial sweeteners are like 1,000 times more sweet than a natural sweetener. And so what happens is it tricks your brain. When you put something super, super sweet in your mouth, your brain is notified that, hey, energy's coming. Woo, energy's coming. A lot of energy's coming. It's really, really sweet. And then you swallow it, and your brain eventually figures out, where's my energy? Where's my sugar? And it's not there. But your brain has already prepared your body to receive this influx of energy. So what happens then is you start to graze. That's what happens with artificial sweeteners. And you're going to notice about an hour later, you're going to start snacking because your brain's saying, hey, man, I need it. You told me it was coming. Give it to me. Give it to me. And you start grazing. And that is why artificial sweeteners are actually much more linked to obesity than sugars. It's just it messes with brain chemistry way too much. But I understand you're a diabetic and you're doing that. I think that it's just it's we have to understand that sweetness triggers pleasure in our brain. It triggers an addiction center in our brain. And so we all get habituated to sweetness. We want the sweetness. The more you eat, the more you want. The more you eat, the more you want, because it's triggering this sugar addiction center. And that sugar addiction center, I think, if I remember correctly, is as powerful as heroin addiction. And so trying to get yourself off of sweetness entirely would be important if you can. The subtypes are, it's based a lot on your symptoms. I mean, when I work with patients, we talk about symptoms, and then I send you off to the doctor to confirm what you're telling me, and that helps us. You guys just please understand that only top tier doctors are doing subtyping, and they often have their own system. They don't use a system that I use from Chris Payne. It's the lower doctors, the local doctors or the regional doctors. So you walk in and say, what's my subtype? They're going to go, I don't know, because they literally don't know. I mean, this is really only at the top tier level that this whole discussion is happening. Terry says, is decaf coffee okay? And the answer is no, probably not. if we're trying to get your bladder healed, you got to be off of the irritants for like 2 months. And then once your bladder has had an opportunity to calm down and the nerves to calm down and the skin to repair itself, then you might be able to start with a truly low acid coffee, or better yet, dandy blend and herbal coffee, which is what makes this, which I drink, as you all know, almost every Sunday. Eugene is watching from Zambia. Hi, Eugene. We do have IC patients in Africa, no doubt about it. Shannon says, I drink coffee, but take 2 pre-leafs every time. I always take 2 pre-leaf when eating or drinking something with acid. Yeah, but listen, if you got wounds in your bladder, would you pour coffee with pre-leaf in them? And the answer is no. Terry says, I've taken a multivitamin for years, stopping that. You guys on YouTube, you're being very quiet. Anybody on YouTube have questions? I know you're watching because I see you there. I see you there. I know you're watching. Okay. Terry says, taking a multivitamin for years, stopping that too. Good grief. Let me show you the one. Here, hold on. Let me go get it. Hold on. Oh, I am sweaty. It is hot here. This is the low acid vitamin that we suggest. And you guys, the whole concept of a low acid vitamin was actually something that I collaborated on with FAR Laboratories. The CEO of the company and I were talking years ago, about over a decade ago. And he goes, Jill, if you could make anything for an IC patient, what would you make? And I went, I know exactly what I'd make. I'd make a low acid vitamin. He goes, why? I said, because people ask me every day, what's a bladder friendly vitamin? And I say none. 6 weeks later, he called me back. He said, we've made your low acid vitamin. The first low acid vitamin is called Multirite. And you can still get that. The challenge with, and we sold it for years. The challenge with Multirite is it's a big giant horse pill. I mean, I couldn't swallow it. I'd have to cut it up. And so I asked a Natural Approach Nutrition, the company that makes Bladder Builder, if they would make us another low acid vitamin. God, and they nailed it. This is, I mean, I take this every night. I've never flared from it. And instead of it using ascorbic acid, it uses calcium ascorbate. And then its source of calcium is calcium glycerophosphate. Hello, pre-leaf. And so the best tolerated low acid vitamin on the market, in my opinion, is Bladder Smart. There's 3 now. I won't mention the other one by name, but because they're direct competitors. And I'm somewhat invested in this because it was my idea. Shannon says, anything with vitamin C gives me a flare up. Yep. Tammy says, when I first got IC, my doctor would use silver nitrate on my bladder. Right. Lorraine says, are there any success stories after cystectomy? Lorraine, I have a support forum on our website that's run by a woman who had a very successful cystectomy. Cystectomy is also known as bladder removal. Bladder removal is really only done in patients whose bladders are profoundly damaged and shrunken. So if your bladder is like the size of a walnut, then we're talking bladder removal. It could really improve quality of life, or at least bladder augmentation, where they might attach a little bit of intestine to try to increase the bladder capacity to this. Unfortunately, cystectomy is a really rough surgery to recover from. It takes quite some time. I've worked with many patients over the years who have eventually had their bladder removed. I had a sweet little old lady in my first support group back in 1993 who had her bladder removed, and she was stunned that she still had pain. And that was, now we understand that, because for many patients, the pain really isn't coming from your bladder. It could be coming from muscles or nerves or fibroid tumors or something else. And so, that's the double-edged sword of cystectomy, is if you're thinking that it's going to reduce pain, it might not. And it's a painful process to recover from. And that's why subtypes are so helpful now, because now we can look beyond the bladder. Now we can really understand the other things that can be triggering pain. And in fact, listen, Lorraine, hold on a sec. You need this. Listen, this book, Facing Pelvic Pain, just came out earlier this year. This is the book we needed 30 years ago. This is the book that goes over everything else that can cause pain. And it's broken up into chapters like what urogenital problems can lead pelvic pain, what GI problems, what bone and ligament problems. For all we know, the reason why you're in pain is because you got a tailbone that's crooked. Right? And imagine removing your bladder would be a complete waste if it's a bony structure abnormality. We had last year, very important research study came out that showed that 70% of the men with testicular pain in their testicles, had a bad hip. They had a bad hip. This book, Facing Pelvic Pain, is edited by Dr. Elise Day from Harvard. And another doctor from Harvard. And it's free on Kindle Unlimited. It's free. No excuses. It's free, people. If you really honestly do not understand why you're in pain and your bladder looks normal, for God's sake, read this book. It's so good and it's so easy to read. They did such a beautiful job, and it's got great pictures. Look at that. Inflammation of the SI joint. Hello, that would be me. Such a good book. It's such a good book. It will help you solve the mystery of your pelvic pain and really study your body to figure this out. Let's see. Hawk said, after Hunter's ulcers removed, I have 162. Hawk, it scrolled by too quickly. I don't understand that. I'd love to hear more about that. Nikki says, how do you heal a candida infection? You stop feeding it. Candida live on sugar. And if you've ever made yeast bread, you put warm water and sugar in it to let the yeast start to grow. Well, that's what happens in the human body. So you have to stop feeding it, which means you got to reduce your sugars and carbs, and they might give you an antifungal. Lisa says, hi, I do have candida overgrowth. I've treated this before using bentonite clay. Now bentonite clay flares me, and so does diflucan. Lisa, it would be really interesting to do a next generation urine test to see if you still have candida, and if you do, what species it is, because maybe you now have a different species. It might not be Candida albicans. It might be Candida glabrata now, which is really, really drug resistant in some people. Lorraine says, safe antibiotics after tooth extraction. I have developed, oh girl, you have dry socket? Oh, that's so awful. And you're taking amoxicillin and augmentin and you're not feeling well. What should I take that is safe for the bladder? Well, the amoxicillin is maybe a little bit gentler than the augmentin, but hon, you got a wicked infection there. You might have to power through it. And hopefully they can give you some pain meds to try to get you through that prescription. Guys, we can't just say what the right antibiotic is. They have to do the test to determine which antibiotic will kill your infection. Hawk, after I had Hunter's removed, I had 161 days. Hey, this is great. After Hunter's removed, you had 161 days of no spasms, no pain, and voiding normally. Guys, see what happens when you treat lesions correctly? Do not waste your time doing other stuff. Do lesion therapy. Jennifer says, in comparison to last year's wildfires, how bad are they there this year? Exponentially worse. Absolutely worse. Terrifying. It is terrifying. Like my living room is packed. All of my kitchen table, everything we are all packed up, ready to go because they move so quickly. You might only have minutes to get out. Like I was thinking about that this morning because I don't have my, which is a mistake. I should have my cell phone in here for the warnings. You have to pay attention to these warnings and you got to get out fast. Like 45 minutes later, it's that quick. So these fires are crazy. Is IC autoimmune in the USA? The answer is no. We have subtypes. So some people have injuries. Some people have Hunter's lesions. Some people, which might be viral infections. Some people might have a muscle issue. Other people might have endometriosis. Some people might have Tarlov cysts in their bladder. So we can't make any broad statements that IC is autoimmune in everybody. It's certainly not. Is there a subgroup of patients who have an autoimmune issue? Possibly, quite probably. If you've got Sjogren's syndrome and lupus and IC, then we might be able to make the argument that you might have an autoimmune component to it. That has not been defined formally in a subtype yet. Lorraine says, I wonder what it would take to get a urologist to do a cystectomy. There are no magic words. It's about what they see in your bladder. If your bladder's tiny and heavily scarred, they should be talking to you about that. And you say, can hunters develop after years? The answer is no, we don't usually see that. Janice says, thanks, Jill. I'm subtype 2. As I know, I don't drink soda anymore and have cut down to a half a cup of coffee a day. You're almost there. I'm not up due to pain. It's due to frequency. As much as I hate to try, I'll try to see if stopping the coffee helps. The poor sleep started around the time I went through menopause, so maybe it's a loss of estrogen. You just explained it, girl. You just explained it. Your bladder wall cannot defend itself because you're older. So you have a compromised bladder wall. That's not a disease process. That's aging. That's estrogen atrophy. And so your bladder can't defend itself from that half a cup of coffee a day. And that's triggering the alpha afferent nerve, which is triggering your frequency. So yeah, you have to stop the coffee and you got to stop it for at least 2 months and really give everything time to calm down. All right, let me come here to YouTube here. Hold on a second. Love says, don't take pain meds. I don't know, and I don't know an alternate route, but I'm dealing with a pain med addiction now. Honey, I'm sorry. You know, you have to differentiate between addiction versus tolerance also, hon. So, and I've talked about this before, an addict takes pain medicine to escape life. You might be taking pain medicine to escape pain and or so that you can function again. So there's a really clear intentional difference between somebody who's a real strong addict, you know, who's breaking into your house, trying to get the meds because they want to get high, as compared to somebody who's taking pain meds because they're just trying to get through the night. They're trying to get up and make a meal, right? But there's also something called tolerance. And you have to understand that our bodies are miracles, and our bodies have absolutely fascinating ways of dealing with chemicals. It's your liver that ultimately is responsible for processing pharmaceuticals. And when you give it something new, your liver is basically trying to figure out how to break it down. Sometimes it stores stuff in fat. Sometimes it puts it right into your bloodstream so it can go to your kidneys so you can pee it out. I mean, there's this real dynamic process happening in the liver. And what happens over time is the liver gets better at breaking it down. If you're taking the medication every day, your liver is getting better at it every single day. And so 25 milligrams a year ago might have been great, but 25 milligrams now might not touch it simply because your liver is so good at breaking it down. And that's why you have to increase the dose. And there is a real delicate balance here, you know? Love says, yeah, I'm not a true addict, I guess, but you couldn't stop if you wanted to. I will have horrible withdrawals. And then, of course, the IC pain will come back. So hopefully you're working with a pain specialist. And you need to do a lot of reading about what to do. I mean, you can't stop cold turkey. It's about gradually going down when you're using certain types of medications, whether it be pain meds or whether, I mean, there are other medications where you have to do the same thing, like Lyrica, Cymbalta. You can't just stop it. If you stop it, you will go through a detox. You have to be very, very gradual. But love, ultimately, we still have to figure out what's causing your pain in the first place. Because if we can eliminate the source of the pain, then you could gradually get off and we can get you to a better place. So we can't just focus on the pain itself. We always have to focus on the cause of the pain. And the number one cause of severe pain in the IC patient is untreated Hunner's lesions. And as we just had here on Facebook, we had somebody who said she had her Hunner's lesions treated, and for 161 days so far, she has no pain, normal frequency, normal voiding, and life is good. So we want to make sure that Hunner's lesions that are there get treated correctly, because I want for you to feel better. Your doctor wants you to feel better. It's just so easy. And this is, listen, we've all been there. I have been there. I begged my doctor to take my bladder out the first year when I had no pain care. And he went, no, Jill, we haven't done anything yet. You're going to have to try treatments before I even think about doing that. And thank God he didn't, because, therapies worked. But we have to focus on finding the cause. So love, again, for you, this is an important point. This is a very important book for you. And it will help you have much more productive and better discussions with your doctor so that we can get to the root of the problem, right? Shannon says, I now have macular degeneration due to taking Elmeron for 2 years. I'm so sorry, honey. I'm really shocked that doctors are still prescribing it, to be quite honest. In fact, some researchers from Russia published a study in the last month in which they claimed it was safe. And it's like, dudes, like, seriously? Have you looked at the pigmentary maculopathy research? Terry says, is there any artificial sugar that sweetens that is okay? Oh, God, not really. Of all the artificial sugars, probably Splenda is probably the one that's, I mean, there's really not good long-term research with any of them right now. Lorraine says, interleukins are a type of cytokine first thought to be expressed by leukocytes alone, but have been found to be produced by many other body cells. They play an essential role in the activation and differentiation of immune cells, as well as proliferation, maturation, migration, and adhesion. Thank you for that. Much appreciated. I know that they're seeing a dramatic increase in interleukins in COVID too. Lorraine says caffeine, sugar, and red meat are killing us. Well, I think the caffeine and the sugar, absolutely. We are omnivores. We are protein eaters. The red meat industry is certainly damaging the planet, no doubt about that. Nitrates and nitrates might be naturally found in some foods. I don't know if they are. Lorraine says, who is a legendary cystectomy surgeon? Probably Robert Evans at Wake Forest or Ken Peters at Beaumont. Evie says, I'm in so much pain. Evie, I'm so sorry. Josette says, my mom screams in pain with what we think are spasms. Is there anything she can ask the doctor to try? She's on Elmeron, but she feels like it is in more nerve pain. She goes to a new doctor on Monday. So, Josette, neuropain is electrical. It's like you're being shocked, or there's pins and needles, or there is something we call persistent genital arousal disorder, where there's this painful arousal, or you might have pain shooting down a leg, like sciatica, or pain that gets worse when you sit, that gets better when you stand. Listen, you want the doctor to not only look at her bladder, we need to look at her muscles and her nerves. She should have a pelvic floor assessment. Let's see what's going on with her muscles, because it's usually the muscles that are compromising the nerves. She needs to be really clear on the symptoms she's experiencing. And if you'd like to talk, I'd be happy to talk with her to see if I can help a little bit with that. But let's get them to not only look at her bladder, but they also have to look at her muscles. They've got potentially to look at nerves. Again, if she's got any nerve-driven pain, they also need to look at her skin, the quality and health of her skin, because if she's your mom, then obviously she's older, which means she's got estrogen atrophy at some point in time and at some level. And so it could literally be agonizingly dry skin in her urethra, in her bladder, and in her vagina that's causing her to cry out in pain. If her urine feels hot as she's peeing, then that's estrogen atrophy, and that can be treated. Carrie says, where can you buy this vitamin? From us on the IC Network website, icnetwork.org. Just go into our store. You can buy all the supplements that we support on our website. So we got Bladder Builder, Bladder Rest, Cysto Protect, Cysto Renew, Bladder Smart and Pure on our website, and Allopath. Irene says, is there a connection between Ic and Sibo? Not that I believe has been documented. I don't believe I've ever seen anything about that. Trisha says, I drink bio coffee. It's advertised as the only alkaline coffee on the market. It has no caffeine, gluten-free, soy-free. It's made actually from wheatgrass. Have you heard anything about it? No, I haven't. I really like Dandy Blend. Remember, you don't want to go over the top. You don't want to go too alkaline or too acidic. You want to stay neutral. You want to be pH neutral. And Dandy Blend, I think, is the best. Jennifer says, do I recommend InterStim? No. No. I recommend the ankle stem first. But it's not my job to recommend. It's my job to inform, you know. Jennifer says, I thought the whole area near my home was burned. Yeah, it was. It was. It's my hill is covered with dead trees. I was thinking that we'd be at much less risk of fire this year because it's burned, and we've been told by fire officials that no, we're now at double risk of burning because our hills are now covered with charcoal briquettes, also known as burnt tree trunks. I mean, it's shocking. If anybody's been through the Napa Valley or the Sonoma Valley, remember there used to be oak-covered hillsides? They're gone. They're gone. Everything's burned. I mean, like 90% of everything's burned. Shell said, I was told that you have cystitis cystica. My doctor said it's pre-cancer. She didn't really want to give any options to treat. Is there any treatment for it? And I'm gonna start the Zoom meeting in a second here. Hold on a sec. Cystitis cystica appears as translucent submucosal cysts less than 5 millimeters in diameter. It's a metaplasia in the mucus secreting epithelium. The metaplastic lesion of the bladder mucosa with characteristic histopathological appearance. Are you a smoker, hun? Now listen, the number one cause of bladder cancer is smoking, cigarette smoking, by far. By far. All those toxins that get into your lungs usually end up in your urine. 10, I think, like, God, what? I don't even remember it. It's like 50,000 potential carcinogens end up in your urine if you smoke cigarettes. And God forbid you be older and you have estrogen atrophy, then these carcinogens are touching cells and they can trigger cancer. So, I mean, the good news is that it's not cancer now. The bad news is that that they believe that it could possibly happen. So, number one, you should not be smoking at all. And number two, I would want to. They wanted treatment of cystitis cystica involves treating the underlying cause of inflammation. Here, I'm going to give you a link. I can't do it. I'm on the wrong computer. Hey, Shell, send me an email. I'm going to save this. Send me an email to icnetwork@mac.com and I'll send that article to you. Okay. All right. I'm feeling like we might have a good Zoom session. So let me set that up. If y'all don't want to do Zoom, that's perfectly fine. I am here at your pleasure. So our Zoom meeting is an opportunity for anybody to come in and talk to me. And of course, people on YouTube and Facebook, they will not see you, but they will hear you. And so the way to get into our Zoom meeting is to go to our website, icnetwork.org. I can just type it myself. And then you go to the support pull-down menu, and you go to streamed support group meetings. And there's a Zoom link right below the YouTube link. I am starting up that meeting right now. Let's see if anybody wants to do it. Again,
recording in progress.
Okay, you heard it say recording in progress, and you're going to hear me say
recording stopped.
I don't record the Zoom meetings in Zoom, okay? So let's see. So I got the Zoom meeting up and running. Let me give this link to YouTube. Karen says, my urologist said my bladder looks like a 90-year-old woman. What? What does that mean? Is your bladder all wrinkled? All right. Hold on a sec. I need to give the invite to Facebook here. So hold on. All right, Facebook. Which next gen test you should take? The urine test. Evie said, after a total hysterectomy with cystoscope in December, it got worse for you, honey. That's because of estrogen atrophy and or muscle tension. Same thing happened to me 4 years ago when I had my hysterectomy. Jennifer says, do you think involuntary movements could be causing more pain? No, but I think if it's making you tighten your muscles, it could. Evie says, I've been diagnosed with IC, vulvodynia, vaginismus, PFD, and IBS with constipation. You now have a rectocele. What would you suggest for someone with me? Honey, girl, you need to be working with your muscles. Your muscles, girl. You have vaginismus. You've had tight muscles for a very, very long time. The consequence of tight muscles is difficulty urinating, difficulty having bowel movements with constipation, vulvodynia, and ischemia, which is oxygen deprivation, poor blood supply to the bladder, which is why your bladder is probably involved. All right. I hate when I scroll down here because I lose comments. All right. There you go. Facebook, there is your link. Rachel, thank you so much for the 530 stars on Facebook. Woo, much appreciated. Okay, so I just put the link in, and let's see if anybody wants to Zoom. Let's give it a minute. Guys, this is a great time to take a bathroom break. Anybody need to take a bio break? Perfect time to run. So I'm going to admit Lisa and Kayleen. And let's just give it a couple more minutes. I think I'm going to go take a bio break too. I see you, Lisa. Hi, Kayleen. I see you guys too. Quick bio break. Be right back. Where is my cell phone? Hi, Jennifer. All right. All right. So let me. Hey, Evie. Evie is really struggling with really messed up muscles. Girl, I would love to work with you. So, Evie, you need this book. It's called Breaking Through Chronic Pelvic Pain. This is the book for people with vaginismus. This is written by the first urologist to really make the connection between pelvic floor and vaginismus and IC, Dr. Jerome Weiss. It's a love letter for patients. He gives you a roadmap, and it's free on Kindle Unlimited, so no excuses. You really need to do that. So one of the mysteries that he struggled with is, why did muscles stay tight? I mean, you could like legitimately go to physical therapy every week for 6 months. And for some patients, no matter what they did, the muscles stay tight. Why? That was so, because muscles normally respond beautifully to therapy. But for people whose muscles who stay tight, we always have to take a step back and look at bones. Because what puts pressure on muscles but bones? You know, and so if you, for example, have one leg higher than the other, then your hips are out of balance. Let me grab my model here. Right? And the other thing about muscles is it's not just you going to physical therapy, it's about what you're doing at home. Because what you do at home can make a huge difference. So look, here is a normal pelvic cavity, right? So the pelvic cavity is the center of the human body. It carries the weight of your torso through the hip bones, and it deflects any stresses of when you're walking, right? So any forces coming from below are going right up there. And hold on a sec. I gotta shut that door. Here, hold on. I'll be right back. Can you turn that down just a little bit, Dad? We can hear that. We can hear that. It's too loud. I know, but I'm broadcasting to 100 people right now. Just a little bit. Just turn it down a little bit. All right. Sorry about that. Ooh, it's something very red and bright on my screen. Okay. So Evie, think about this, right? So if you have one leg longer than the other, this is how you're walking. That is not normal. That will put long-term stress on your pelvic floor. If you have a tailbone, see, normally your tailbone curves under. If you can see that curve, but if you've broken your tailbone and your tailbone is poking out, it's straight instead of curved, or curved to the left or to the right, that can cause long-term pelvic floor issues. If you have an SI issue, your SI joint, like I do, that can cause long-term pelvic floor tension on one side. If you have a bad hip, something wrong with the way your hip is mechanically operating, that can cause long-term pelvic tension. If you have a bad knee, that can cause problems. But what Dr. Weiss found in his clinic is that 95% of his patients who had long-term chronic pelvic pain, pelvic muscle tension that was causing pelvic pain and bladder issues and all that sort of stuff, it was how they were walking. It was how they were walking. If you're pigeon-toed, where your toes are inward, or you're duck-footed, your toes are outward, or if you have an ankle that rolls when you walk, or if you have Morton's toe, Morton's neuroma, the last piece of figuring out why these muscles are tight comes right back to fixing the feet and getting the feet operating normally so that they're not constantly causing it. And as you say here, you have a hip injury from your childhood after you were hit by a car, right? So that's something we see. So Evie, I would love to work with you, hon. If you could call me, tomorrow's my day off, but I'd love to talk to you sometime this week. Maybe we can do a little bit of brainstorming, and I can give you a few more references that you can learn about here. Okay, so for those of you on Facebook and YouTube, we're going into the Zoom meeting now. I've got 3 people in the Zoom meeting. You have the link. Anybody who wants to come in, you're welcome. Let us go to Jennifer. Jennifer, can you unmute yourself?
Hi.
Hi.
Hi, Jill. How are you doing today?
I'm okay. How are you doing? Okay, you guys, listen, if I didn't call you in order, I apologize. I don't remember if Jennifer, you came in last, right? So
I don't know.
Yeah, you did. So Jennifer, I'm sorry. I'm going to come back to you in a minute, okay? I'm going to go, I'm going to Lisa first. Lisa, I'm sorry about that.
Hi.
Hi, hon. How are you doing today? How is life?
It's okay. I'm the one who was messaging you about having the Cipro, taking Cipro, and then having the long-term pain after.
Okay.
And that's what happened last time. I had a really long flare.
Okay.
And I did like the Candida cleanse stuff, just using bentonite clay, and I'm eating really carefully, but I'm so sensitive to foods right now that I can't eat nuts right now, and I don't know if I can cut out all carbs. Last time I cut out carbs, it messed with my my thyroid, T3, T4, because I ate kind of ketogenic for too long.
Okay.
And so I just have complications. I do think that there's some Candida overgrowth going on. So I'm watching sugar, no gluten. I don't know if you have any suggestions.
Well, I think suggestion number 1 is let's not change your life. Let's verify first if you actually have fungus.
Yeah. Okay.
Right. And so, rather than guessing and potentially making things worse, it would be better to just know one way or the other. So you can go to bladderhealth.org. And that's a website I built that talks about Microgen, the company Microgen. There are a couple of tests that do it. A couple of companies that do it. Another company is I think it's a Periomics or Pathogen. I always get it wrong. Periomics or Pathnogenic, something like that. It's $199 urine test. You order it. They send you the kit. I have a kit right here underneath the chair.
Can I see which one? Because I looked up their webpage and I saw
Oh, they have
several. There was a urine. I think it was just like woman's urine test or something. Is that the one?
It probably is. Let me look.
Okay.
Hold on a sec. Let me go there.
Just want to make sure I get the right one. There were several. I think that would be the one.
It's not the
Not the UTI one, right?
well, no, it is a UTI one.
It is a UTI one.
Yeah. You know, because you can have a fungal infection.
Okay. I
Right.
was thinking like usual doctor's UTI test, like because mine keep coming. You know, I keep testing to make sure I don't have that, but it's it usually comes back negative on their end.
Well, yeah.
But
okay,
this one has more things. Yeah. Okay.
So hold on a sec.
Sure. I did see that one. That's why I was looking at that. I was like, is it that one or just the plain urine test or?
It would be the urinalysis one, the UTI urinalysis test service. Okay. I mean, that would be the one to start with.
Okay.
I mean, the women's complete urine and vaginal swab. I mean, if you're going to go to a gynecologist and a gynecologist would be willing to do a vaginal swab, that's kind of interesting because that's when we might be able to see bacterial vaginosis or yeast in your vagina too. But if you're not having vaginal symptoms and it's really bladder symptoms, then it would just be the UTI one.
Okay. Thank you.
Yeah. And
oh, sorry.
You know, so I had a Candida glabrata infection for 2 years after doing Augmentin for 3 months under the old Dr. Fugazzotto protocol for old timers who remember the Paul Fugazzotto days. And what happened with me was very interesting because I mean, I was like the poster child for yeast at my local Kaiser. I think I saw every single gynecologist on an urgent care at one point in time because, I mean, you guys make no mistake, fungal infections in the bladder are agony. It was the worst infection pain I've ever had was when I had a fungal infection. And it would flare, and then I would be crying, and then I would be at the gynecologist, and they would do swabs. So we did multiple courses of diflucan, 7-day courses of diflucan, because if you read the product information sheet that comes with the diflucan, it specifically says there are some infections that will not respond to a single dose of diflucan. They require longer term doses. So we did, I'm going to say 4 courses of 7-day diflucan. Didn't work. And so then the next thing they did, again, I was seeing a lot of different gynecologists, is they used gentian violet and they colored my parts purple, which is an old, it's an old, you know, they do it a lot on animals where they put gentian violet on their skin and it will kill whatever's on that skin. And so I had 4 or 5 treatments of gentian violet. And it didn't hurt when they did it, but it hurt afterwards because it's pretty astringent. In the end, though, what made the difference for me was specifically after an appointment or during an appointment, and I was bawling I thought I had ovarian cysts. Like I was crying. The pain was so severe. And they do the sonogram, no cyst. And then he does the examination and he gasped when he looked at me. He goes, "Oh my God, I can see it burrowed into your vulva." And I was like, okay. And he said, "Aren't you using the cream we gave you with the diflucan?" And I went, "No, because I thought the diflucan killed everything." And he explained that no, there's not enough blood supply in the vulva to deliver enough of the medication to the vulva to kill candida on the vulva orally. He said, that's why we give you nystatin cream. And so he said what he believed is that the candida was living on my vulva happily, reseeding my urinary tract, reseeding my vagina, because I did not, and I'm a pharmacologist, and I did not understand that. I just thought diflucan, I mean, with the doses of diflucan they were giving me, I thought it would kill everything. And the doses were so high that they had to do liver toxicity tests because we were just trying to kill this. And in hindsight now, I realize we probably could have killed it the first time around with that first course of diflucan with the correct topical, with modifying your diet. The other thing I noticed for me is that every single time I ate ice cream, it grew. Anything with milk sugar, bam, it grew. I was in pain within 12 hours. And so I did not eat dairy for probably a decade afterwards. I do coconut milk. I do mocha mix. And I can do a little bit of dairy now, but I never do a lot. I can do a little bit of cheese now, but I can't do a lot. So
yeah, dairy flares me right now. And I know with any kind of yeast stuff, dairy is probably not your friend, right?
It's
probably not my friend right now. So I don't eat, basically I eat like Brussels sprouts, broccoli, green beans, chicken, eggs, olive oil. I do have some potatoes and rice. So like potatoes is probably too starchy. Rice and like steel cut organic oats. That's like what I eat. That's probably it. That may be too much for the candida. I don't know.
Well, I think the lead article in our magazine, our summer magazine, is by a registered dietitian, Callie Cregier, and it's to help us understand the consequences of a very severely limited diet. I mean, technically, what you're doing is very healthy, but
it's just that everything else flares me, even bananas, avocados, you name it. Like so lectin foods, histamine foods, anything that's
So has anybody looked in your bladder?
They have in the past. I'm afraid to have anybody look again since the Cipro because this is from infections. I don't want anything else going inside of me right now. I don't know. What are your thoughts?
Well, I mean, you're forcing them to guess. And that level of diet sensitivity really is reflective of Hunner's lesions. Do you have a history of Hunner's lesions?
No, I don't. I mean, every time he's checked, I haven't, but I was on 5 weeks of Cipro, and that stuff is a beast.
It is. It's terrible. Well, okay. So, I mean, I think number one, the next generation urine test will tell us everything we need to know about your urine. Okay. It'll tell us good bacteria. It'll tell us bad bacteria. It will tell us fungi, and it will be it will give us really good insight into the consequences that Cipro did to your biome.
So if it is Hunner's lesions, what I was starting to wonder about that because the pain, usually when I would eat something that was maybe a flare food, it would go from 1 to 3 and I think, oh, better be careful. But this is like severe pain and even taking Proteum burns my bladder. It's like the dye hurts me.
Did you have COVID last year? Have you had COVID?
I had the vaccine, but not COVID to my knowledge.
Okay.
Yeah. Okay. I think this is from Cipro. This happened to me in the past.
Okay.
And then it started calming down over time, but then anytime I would have anything with like sugar, but I'm so sensitive to everything right now. Like I have never been so sensitive to so many foods. I can't eat cashews anymore. Like, and I don't know, I'm hoping it's just like a yeast overgrowth. And once we heal that, I'll be able to have.
Do you have super sensitive skin?
Like allergy wise, yeah, my eye starts swelling and I get like.
But can you wear wool?
No, never.
Okay. Do you have a wicked sense of smell? Can you smell things that other people can't smell, and do smells drive you crazy?
Yeah, I'm pretty sensitive to smells, probably.
So and have you been that way your whole life?
I think it's more so. Like I definitely think since being on all these antibiotics, it definitely messed with me.
So I see subtype 5 central sensitization, chronic overlapping pain conditions. These are patients who are extremely sensitive We have very sensitive nerves in our skin. We have very sensitive nerve. We have a tremendous smell sensitivity. We have bladder sensitivity, bowel sensitivity, stomach sensitivity, because it's a systemic central nervous system sensitivity. And in many cases, it's inherited. It's inherited. Hello, redhead. I mean, it's very common in redheads.
I think it got way worse from taking the Cipro, because Cipro can actually cause nervous system stuff. And I feel like I am always more sensitive, but now it's like off the charts.
So it might be, it would be interesting to talk with a neurologist about it, perhaps. And what would be fascinating would be to see if something like Peora, palmitoethanolamide, helped reduce some of that sensitivity. And the reason why I say that is because PEA, known as palmitoethanolamide, has been used in Europe for decades for pain. There are massive studies on it. And we have our first IC study that was presented 2 years ago that showed that it was remarkably successful at reducing pain in the bladder, that by month 3, 87% of patients were significantly better. And by month 6, about 20 to 25% of those patients were completely pain-free using PEA. PEA is a simple fatty acid, very, very well tolerated. And the consensus among the researchers is that it is the best at calming nerve pain down. So I am IC subtype 5, IC subtype 3. And the way I know when my nerves are getting out of control is I start feeling pinpricks, random little pinpricks on my leg, on my shoulder, on my back. It's just a little stab here, a little stab there. Just random. And it's the worst as I'm going. It was the worst as I was going to bed. I would be chasing it with cream. I have CeraVe cream and I have CeraVe itch relief cream. And so wherever I felt it, I just put a little dab. But some nights I couldn't sleep. I'd have to take pain meds just to go to sleep because I had so many pinpricks. So that's when I decided personally to try PEA, and it's gone. As long as I take the PEA, my pinpricks are down to 1 a week instead of 100 a day. And so that might be kind of interesting, but ultimately in the end, I think we're just guessing, and you deserve better than a guess. And I think those test results would be interesting. Let's see what that has to say.
So can I just ask you, when you had that form of Candida, the other, what was it called? Candida with an L?
Candida glabrata, GLABRATA, which is considered to be the most drug-resistant form of Candida.
How did you get rid of it then? What did you, just diet? Because you did the diflucan and that didn't work. Or?
Well, it was a combination of things. I had to stop feeding it. So diet modification was huge. Losing the milk and the sugar, all that was critical.
Yeah.
And then I did not understand the location and the fact. I know what triggered it was I took the Augmentin, but one of my best friends at the time gave me a heated chair cushion that I was sitting on here in my office. And the worst thing you can do is sit on anything hot because you're basically cooking. And and there you go. Here, hold on. I've got an error message on my phone.
Ice packs are all I use. Heat is not my friend either. I use ice packs.
Yeah. But the heat creates a perfect environment for the Candida to grow. I also didn't wear a lot of underwear, or I basically cut a line straight through the crotch of the underwear. And that's what I wore at night for 20 years, just to try to keep things calm.
Okay.
Yeah.
So you didn't have a systemic, like throughout your body infection. It was just down there. Did they test?
Well, it was in my bladder and it was in my vagina and it was on my skin down there. And it might have been, I never got white spots in my mouth, but I did deal with burning mouth on occasion.
Yeah, I have that.
Yeah. And also, just so you know, there's a PEA, burning mouth syndrome, a study that was also found to be very successful. So it's kind of two theories on the burning mouth thrush and or nerves that are irritated. So that would be another fascinating thing to try. So we just finally got to the point when I finally understood that it was living on my vulva and that I just hadn't treated it correctly. It was all about the nystatin cream. They gave me a nystatin triamcinolone cream, and that in the end is what fixed it. And whenever I felt it coming back, you know, that's what, I mean, I haven't had it in a decade, but my little tube of nystatin triamcinolone cream was my savior. That's ultimately in the end what killed it.
Okay.
Okay. All right, hon. Well, listen, I hope you keep in touch and let me know what they find, and we can dive into the research a little bit more if you want. I'd be happy to try to do that with you. Okay.
Okay. Thank you.
Okay. All right, hon. Great talking with you. Now we're going to go to Kayleen. Hello, my dear. How are you today?
Not feeling too good. I can't talk that loud because I'm not feeling good. But it's just yeah, I had the hydro distension and the cystoscopy.
Okay.
And I mean,
what'd they find?
Good news, but I'm so frustrated. He said that my bladder was small.
Okay.
And then so he did stretch it, obviously. And then he said that it was a little bit inflamed.
Okay.
Which he said that explains why, like, pretty much I've had a UTI like 2 times in the past 3 months, plus that kidney infection. Like, that kidney infection was bugging my GI tract. It was bugging the rest of my, urinary tract. But I had, my gastritis has been acting up, so that's why oh my God, I do not feel good.
Yeah. Well, your body, when did you have the hydro? You had it this week, right? Last week.
Yeah. Wednesday.
Okay.
So, I'm still, well, I'm not still, I did change out. Obviously I've showered, but I'm wearing, my straight out of surgery shirt.
Yeah. I love it.
And
I love it.
I noticed that you're wearing Champion, which is, my thing. But they gave me some kind of GI cocktail. It really did help.
You mean they gave you a bladder cocktail or a GI cocktail?
A GI cocktail.
Okay.
Which I didn't even think like it was like they could do it, because they're about to give me like anesthesia and here goes something in my stomach. So I don't know if I like threw up like during surgery when I was under. I was kind of picking on them too, because I'm like, I want to fight the anesthesia.
Well,
just
yeah.
to, for the fun of it. And I'm like, I don't think that'd be good on my mental health. So I'm like, we'll go ahead and just not do it. But I'm that kind of person though, that I get anxiety if I go from like the pre-op room to the recovery room. And then I'm like, how in the hell did I get here? So I have them put the anesthesia in me, or the amnesia stuff, whatever it is. I think it's a propofol. But yeah, I had them give me that
or
after I'm in the OR.
Okay.
So
or
that way I get
yeah.
It's a lot easier going from the ER to the recovery. I mean, the OR to the recovery room.
Okay, so but so let's get specific here. So they did not find Hunter's lesions on your bladder, correct?
Nope, just inflammation, and my bladder was small.
Okay, so. But that's great news. So we got good news from the test. Did they rate the inflammation? Did they say it's severe? Did they say it mild? What did they say?
I don't think anything. I mean, my grandma.
Okay.
She was the one that he called, since my dad had dropped me off, and he picked me up. He lived like 7 minutes down the road. So
okay. Did they take pictures? Did you see a picture of your bladder?
I might get to see them when I do see him.
Okay.
It's supposed to be a follow-up in a month.
Okay.
But I'm going to the ER tonight. I know. I'm gonna wait for my mom to get home, and
why?
I'm just gonna go for it's my stomach, and
Okay.
I mean, I don't know if the pain, like, or yeah, if it should be like a low level pain, like after hydrodistension. But I mean, my urethra is fine. It's
Okay.
just like everything. Well, my bladder does hurt because I mean, I'm still getting that problem that I had before the hydrodistension, where it's just like it's hard to explain. Like I don't know if my bladder is like full or if it thinks that it's full, but I mean it's not really like a spasm, but it is. I can tell like the whole roundness of my bladder. It hurts.
Well, you
And
know,
so I'm like,
yeah. But
I
so, you know, I'm fully in support of you going to the ER. I always tell everybody, listen, there's nothing like a fresh set of eyes to see if there's anything else that
right.
might be going wrong. You could have a post-op infection. It's always good to look at that. But you know, I think the other thing you've really got to understand is that whenever you have a hydrodistension, it's probably going to take a week to 2 weeks for things to calm down, and you're only 4 days out after your hydro. So you could be dealing just with some post-surgical irritation and recovery. You're kind of in that normal recovery time. But I say, man, get a fresh set of eyes. If you feel that that's where you need to be, go. I have no problem with you doing that.
It's just, I mean, especially if it's my endometriosis, like I do want a transvaginal ultrasound tonight, hopefully. I mean, that will maybe show a little bit of a shadow on something.
Yeah.
The only thing is I don't have an endometriosis doctor. I don't have like a pelvic floor doctor. It's the only thing I have is my OBGYN that does, you know, like my swabs and pap smears and birth control, and
Can't she refer you to a pelvic floor specialist?
she's referred me to that urogynecologist that did my first cystoscopy, and she was horrible.
No. But I mean a physical therapist. Normally, they would refer you to a physical therapist.
Oh yeah, she has. Sorry, I didn't think of therapist. But yeah, I've been to her twice, and the second time it didn't help at all.
I know, but you're not being real, girl. Come on now, you're not being real. Going to a physical therapist appointment is not going to make you better immediately because your muscles.
Right.
You have a lot going on. You have because we've talked about this. You've talked about this several times. We know you've got a low back injury. We know that you've got, because of that low back injury, a wide variety of other issues that could be going on. You also have endometriosis. And as a consequence of all of this pain, your muscles are extremely tight. They have to be. They cannot not be.
Mm-hmm.
Whenever you're in your pain, your muscles get tight. Your muscles are tight right now from your hydrodistension. Okay. And so it's when you go to the physical therapist, they're working to get those muscles to relax again. But normally it's going to take 5 or 6 visits for things to really collectively improve, especially as they teach you what you need to do so that you can check in with your muscles and keep your muscle, get your glass wand out and use it correctly. So that's I know, but girl, it is what it is. It's the only way you can access the muscles. I mean,
I can't even sit without my vulvodynia just like.
But I know, but vulvodynia is often caused by tight muscles.
Yeah, it's hard, and then also getting the estradiol cream in. That's mostly a no. And here.
Well, why? Why is putting the estrogen cream in a no?
It's just I feel like there's just that cold burn, and then before I know it, like my urethra is affected, and I get mastitis, and which is, I mean, I know that it soaks it up. Yeah, my body soaks it up. So it's the estrogen. So I'm like on estrogen overload. But I don't really have problems with estrogen since I'm on birth control, for the PCOS. But
Yeah.
there's just sometimes where like I just get severe mastitis. So I'm like afraid of taking more estrogen, and I can't get testosterone because testosterone makes my vulva like throb. I mean,
Oh yeah,
and
no.
that
I
just,
mean, girl, your pelvis down there is just it's chaotic right now. There are so many different things going on that are leaving you in constant chronic tension, and you just have to break it out into functional areas that you can work on. So we know you can work on the muscles. You can work on the muscles, and you can do that at home. We know that you can follow the diet and work on the bladder to protect your bladder. And if you lump it all together, you're going to feel completely overwhelmed and hopeless. You can't do that because we know that muscle therapy works beautifully. We know that
Yes.
diet will help calm your bladder so that food's not irritating your bladder so much because of your estrogen issues. And then ultimately, in the end, the big piece of this puzzle that's missing is working on your back and getting your back fixed because they delayed that surgery. And so
he's in office still, and I just, oh my God.
I know,
guess
but
he's not doing any surgeries.
but my concern here, and I'm saying this with love in my heart, girl, and you know this because we've talked a long time, is that you are stopping yourself from doing stuff. You're assuming it won't work, or you're assuming that you can't do it, and you're a tough bitch. You can do it.
Yeah.
Yeah, and I say that with love because we are the same way. You're tough in all the best ways. You've gotten this far. And in COVID, in all of this hell that we're all in right now, you are alive, you are kicking, and you are fighting back. But it can feel very, very overwhelming. And so for those moments, just break it into small, manageable pieces. Nobody expects you to solve the world in one appointment. It's about taking little steps every day that over time build a nice foundation. So let's just go back to the basics. Drink the normal amount of water that your body thrives on. Follow the IC diet, the diet that works for you. Do your muscle relaxation that we know will relax those muscles and calm the nerves. Do your positivity. Do your I Spy. Let's get your central nervous system calmed down so that it's not so reactive, right? Little steps each day. Being consistent is everything. Like literally, when you wake up in the morning, before you put your clothes on, go into your living room, lay down on the floor, and just do your relaxation or your whatever, mini stretching exercises that can help you start the day purposefully and feeling good, right?
Yeah, I'll have to lock the puppy up.
Well,
we just got a puppy. Well, she's a year old. We rescued her, but she's crazy.
Well, listen, you are still in your post-op recovery. So give yourself a break. Let's see how you are in another week. The odds are you'd be feeling much better then. And then we just have these key core issues that we still have to focus on. And that is the endometriosis, the PCOS, and your back. And ultimately, when you're working with your doctors, it's like, we know the symptoms. The symptoms are you're in rough shape with pain. What are we going to do to fix it? What are we going to do to fix it to get you to that another step?
I would really like to get rid of that bladder pain where, I mean, it's just full bladder. I'm fully like just paralyzed, and I'm, scrunching my face in pain and just waiting for that to subside. So it takes like 10 to 30 seconds to subside, and then
so is it
go to the bathroom.
So it's a bladder spasm. So you're having a spasm, correct?
Yeah. That's
okay. So with this,
it mostly feels like.
So with the spasms, you would use an antispasmodic like ditropan.
I wonder if that will work better than oxybutynin, because I've been on oxybutynin.
It's the same
and
thing.
amitriptyline, and it made my mouth so dry. And then I was about to get braces, and I'm like, no,
Okay,
I'm not.
okay,
That's
but
disgusting.
but the amitriptyline, absolutely notorious for causing extremely dry mouth. Okay.
Oh, so that's
Extremely
why.
dry mouth. I had dry mouth on it. But the far more important question is, when you were taking the oxybutynin, did it stop the spasm?
For the most part, yes.
Well, okay.
I mean, I'm taking it now, but he only gave me like 7 days worth. I
Well,
mean, it's just
okay.
enough just to stop the spasms.
But we would,
spasms.
we would expect you to have post-op spasms. 7 days completely. That's good. That's good, because you take
Right.
it when you have the spasm. So you know, you got this, but you're just a wee bit self-defeating. You know, it's like, no, I don't know if I want to do this. You're a little tiny bit passive aggressive. I say that because I'm the same way. You know, it's very easy to go, oh, I don't know, maybe, no, you know.
I'm stubborn too. So.
I know, but it's not, but now we got to balance that with, you know, this is great. I used to teach small business classes before I went to grad school. There was a guy, motivational speaker named Jack Canfield. And he said, how do you get satisfaction? The only way you could get satisfaction is if you take action. But the only way you can take action is if you ask the question first. So it's ask, action, satisfaction. And so the challenge here is you're asking the question, but you're bailing on the action.
Right.
Okay. And the only way we're going to get your body better is if you start taking more action to work on those muscles, et cetera, et cetera. So anyway, listen, girl, I'm here for you. Everybody watching this, you got to know, I love Kayleen. We are kindred spirits here. I pride myself in being a tough bitch, and I think you are a tough bitch in the best possible way.
Yes.
You be a fighter, but be willing to take action to help yourself too, right? That which is done for you, let it be done. That which you must do for yourself, do it.
I have to get just a pelvic floor doctor. Well, yeah, pelvic everything doctor, pretty much.
Well,
not just pelvic floor.
Yeah, I mean, you know, but it's just like, okay, doc, listen, we know I've got pelvic floor tension. The question is why. And I'd like to know the status of my endometriosis. I'd like to know the status of my polycystic ovarian syndrome. That's it. That's it in a nutshell. And then the third question is going to be, if my PCOS is quiet, if my endo is quiet, is it my back that's triggering my pelvic pain? Listen, before your next appointment, call me and let's put together the questions so that you can.
For the urologist?
Yeah, and for your OBGYN.
Okay.
Okay.
I just called them after surgery, and I was like, I have nothing else to do because, you know, now this just came out normal, and he did his job on stretching my bladder.
Okay.
And
so that's good news. So no, come on. You just had the best possible news. You do not have Hunner's lesions. You do not have Hunner's lesions.
Yeah.
Okay, so you do not you do not have severe bladder disease. Okay?
Or PBS.
So maybe what you need to do is back off on thinking about the bladder as the cause of your problem and focus more on the other things being the cause of your problem. Like your muscle. Whoa, hold on. That was Cindy. So listen, Kayleen, I got time is running. I have got to keep going. But again, you just had the test. You do not have Hunner's lesions.
So it's just my OBGYN won't do the checking, you know, around my bladder. But
okay, but celebrate that for the good news that is. This is great news. Now we're going to look past that. Now we're going to look beyond the bladder to try to figure out what's driving these symptoms. So I commend you. You had it done. This is great news. Now we can walk away from that theory, and now we got to focus on some other things. Okay?
Right.
Okay.
All right. Well, thank you. I'll talk to you next week, or I'll call you during the week. It's just I do have school, so.
Okay, sounds good. I'll talk to you later. Oh,
bye-bye.
Bye-bye. Okay, Jennifer. Jennifer, are you there? I think Jennifer has walked away from her computer. Jennifer. Okay, let's go to Cindy. Hello,
Hey,
Cindy.
Jill.
How are you, hon? How are you doing today?
Okay, I just have a question about the mic. Is it Microgen?
Okay.
Yeah. So I had it done, and my urogynecologist, she said that the results that I got were because I still have to self-cath.
Okay. What?
So, yeah, I don't even know what that means.
Okay, say that to me again. I don't understand. So,
I have to self-cath.
okay.
So she said that the results that she read was because of what I have to self-cath. So there's always going to be bacteria in there.
Well, there's always bacteria in your urine and in your bladder. There's good bacteria in your bladder all the time. So I don't understand.
I really don't either. Well, I see another UroGYN on Tuesday.
Okay.
To try to figure out why I still have to self-cath.
Okay.
And my other question is, tomorrow I'm supposed to see a new pelvic floor person, but I'm so worried about this variant to go in person.
Well, as my best friend says to me, literally, one of the safest places you could possibly be is in a medical care provider's office who's practicing sterile, proper sterile technique. Everybody who goes to PT is wearing a mask. They should all be wearing their mask and their protective equipment. It's a hell of a lot safer than walking into a grocery store or a school right now. So
yeah, the only thing is, like, a lot of it's going to be breathing, and I'm going to have to wear a mask to be doing that.
Yes, you do. You absolutely do need to be wearing a mask. No doubt about that.
Yeah, I don't go anywhere without a mask, but I just wonder how I'm going to do this breathing piece with a mask on. Anyway,
well,
yeah, those questions. I'm a little bit nervous about doing it in person.
Well, I would talk to them on the phone and say, I have concerns about COVID. What are you doing in your clinic to keep it safe for us?
Yeah, I'll call them first.
Okay.
Yeah.
Yeah. I mean, I understand. I didn't go to a dentist for a year because I thought, man, having people with open mouths in a clinic, yeah, that's not an idea. Or anything like church or anything where people are singing, because that's doing a lot, that's letting a lot out. But what's happening is like dentists now have air purifiers by every chair, and the air circulates like every minute. And
because
so
I had some stuff done too during the pandemic.
Yeah.
And it was safe.
Yeah. Yeah. So I don't understand what she's saying about, you'll always have bacteria in there because you're self-cathing. I mean, there's always bacteria in there anyway. I think the question is are you pushing in potentially pathogenic bacteria? And, I mean, that's what happens whenever that there's always a risk of in catheterization or in doing some sort of procedure that could happen. But I don't understand her statement at all.
I guess they colonize, and she said it's because of the colonization is what she saw in the results.
But what specifically did she see in the results? Did she identify the bacteria?
She did not.
Hmm.
And I'm going to take this test to the new Euro GYN because I'm not real happy right now.
Okay.
Yeah. So anyway, that's my story. I just
Okay.
wanted to say hi.
Well, thank you so much for saying hi. I really appreciate hearing from you, and let me know what they have to say. Okay. That's very, very
Yeah.
interesting.
I will. Thanks.
Okay. All right. Thanks, honey. Okay. Jennifer. Jennifer is back. Hello, Jennifer. And Sierra, you're the last one, Sierra. So just hold tight. Hey, Jennifer, how are you today, hon? And thank you for your patience, hon. I appreciate that.
I'm hanging in there. With my foot, my foot and ankle had to go get new ice packs.
So how is your IC? How are you doing?
It's kind of fair to Midland.
Okay.
I always use an ice pack in that area.
Okay, I don't understand that. What do you have in that area? You always
use an ice pack.
Oh, you use an ice pack in the area. So usually when somebody uses ice, that's because it calms nerves down. When people use heat, because it relaxes muscle. So does heat make you worse? And that's why you like ice?
I think it maybe because I have ice for everything else.
Okay. And how long? And hun, how old are you?
We'll be 54 in September.
Okay. And is your bladder pain or is your pelvic pain inside of your body or on the skin on the outside of your body?
Inside.
Okay. Is it in your vagina or your urethra or your rectum?
I don't really know.
Is it above your pubic bone?
I know I have some pain in my perineum.
Okay, so your perineum is on your skin on the outside, but in a line going down from your belly button. Do you have pain like right here?
No, not really.
Where is your pain, over here or over here? Where's your pain?
Kind of comes and goes.
I know, but where is it? Is it, so again, think about your belly button. Okay, so like, look, here's my belly button and my COVID tummy. Everybody, bear with me. Yes, this is my cinnamon roll COVID belly. Okay, so if we were to draw a straight line down right between your legs, your bladder is right above your pubic bone. So your bladder's right here. So do you have pain here? Or do you have pain here? Or do you have pain here? Where's your pain?
A little bit in all three.
Okay.
I know I have pelvic dysfunction.
Okay, so you do have pelvic floor dysfunction. Are you, somebody says, I'm glad you're showing us your icy belly. Oh, girl, you should have seen it last night. It was big. Does anything make your pain worse?
Bad foods.
Okay. And okay, so you definitely, if you eat the wrong food, you flare. Okay.
Right away.
And how long has this been going for you? Has this been for years or is this just in the last couple of years?
I was diagnosed in March of 2014.
Okay, so this has been a good long while. This has been 7 years for you. And so you would have been 45 when this began, right? 7 years ago. So, did anything happen when you were 45 that you thought triggered all this for you?
No, I was a teacher for years.
Okay. Did you have
and had had a pattern of not being able to use the restroom when I
Okay.
needed to.
Okay. Okay.
During that period of time, which was from basically substitute teaching in 1991 all the way through 95, and then my friend and I moved to Texas and found teaching jobs down there.
Okay. What grade did you teach?
I worked with 5th grade learning disabled students.
Okay. Okay. So,
But my major problem was that I did not have a classroom next door to me, so I could not
right.
ask the teacher next door.
Did you have you had a hysterectomy?
No,
Okay.
I'm one of those really strange 53 and 11, 12-year-old virgins.
Okay. Are you still having periods?
No,
When did your periods stop?
about 2 years ago.
Okay. So it might surprise you, Jennifer, to learn that when we did a professional survey of our members, the number one profession associated with IC is teaching. Teaching.
Yeah, my doctor in Texas hated us.
And then the second profession was nursing. And both are associated with limited restroom access.
Exactly.
And if you were drinking, if you were drinking coffee or soda for a long period of time, you were then holding that in your bladder for a long period of time, which could have caused a lot of chemical irritation of your bladder. So concept number one is going to be, do you have
in approximately 1998 or so, my teacher friend and I had come up here to visit for a while, to visit my parents who were alive at that point.
Yeah.
She and I were doing like 5 o'clock coffee, and along with good old fashioned Reese's peanut butter balls.
Uh-oh.
5 o'clock every day.
Oh boy.
For like 3 months or so. And then at the end of it, I was about ready to leave to go back to Texas. Because they start school like August 9th or 10th.
Right. So, but the fact that, okay.
But anyway, let me just finish my sentence there.
Yeah.
We both made a verbal commitment to give up caffeine.
Okay. Awesome.
At that time. And she failed. I did not.
Good. Awesome.
Amazingly. Although I had headaches, etc. But it was fairly good.
Yeah.
I finally realized that, how terrible it actually was for me.
Right. So, what are you doing now? What treatments are you doing?
Pretty much not much of anything.
Okay.
Went off Elmoran last year because of the eye problem thing.
Okay. Are you sleeping through the night?
That's another story. I have narcolepsy.
Okay.
That's another problem.
Have you gotten worse since you stopped the Elmoran?
A little bit.
Okay. So have you given any consideration to trying any of the supplements that might provide a little bit of a coating effect, like the Cystoprotec or bladder builder or something like that?
I don't really have a whole, I'm on SSI, so I don't really have a whole lot of
Okay. Okay.
finances.
Well, so are you working with a are you working with a urologist or a physical therapist yet?
I finally met my new OG, whatever, OBGYN, women's health lady,
Okay.
but about a year, well, during COVID sometime, I found out that I could no longer go get bladder installations with my your comments on your video. Anyway, they try to keep my thoughts together.
Okay, that's
kind of
okay.
fun.
That's okay. So, so let's just try to run this down a little bit because I've got one more person and then we got about another 15, 20 minutes on Zoom. So what can I help you with today, right now? What kind of information are you looking for?
I think since I just started menopause,
Oh, yeah.
I think I need maybe assistance with what I could do, if I can do anything for that.
Well, of course you can. So I have a video on our website called the Estrogen Chat. So what happened?
I've been taking or using what's it called, Permarin cream.
Okay. And how does that feel when you use it?
That feels good.
Okay. How often are you using it?
At least once a week.
Okay, is that what they told you to do?
They said up to twice a week.
Right. So that's the single most important thing that's going to help is that estrogen, because that estrogen, your skin immediately starts to use that estrogen to make your skin stronger. And so, you really want to make sure you're being really consistent with it. If they said 2 times a week, go for 2 times a week. And then you would normally do a check-in, maybe 3-6 months later, go back to the gynecologist, have them look at your skin and see if you need a little bit more. I think and so when we think about estrogen atrophy, there's a lot of vulvar irritation. Does your urine feel hot as you're trying to pee?
It did.
Like it's burning your skin as it's coming out of your body? Does your urine feel hot that way?
Not as bad as like it used to.
Good. Okay.
At the beginning.
Okay.
At the beginning of my.
So that means that the estrogen is working. So that's good.
But today it was pretty warm.
Okay. But when had you last used your estrogen?
Probably a week and a half ago.
All right, my friends. Here we go. You're my IC sister. You can't do that with estrogen. You're just a little tiny bit passive there. Listen.
I'm just a baby.
So what happens with me? So what happened to you happens to me. If I don't use my estrogen for like 10 days to 2 weeks, the heat comes right back. So when it starts feeling hot, it just means you haven't used it. And you have to be more regular. You're being I'm only saying this because I do exactly the same thing. I do exactly the same thing. And so it's very important that we be consistent on a daily and weekly basis. Okay,
I guess
so
I didn't realize exactly
it's so important. It's very, very important.
what's really what it was really used for.
Yeah. Well, it's your skin gets dry, and because it gets dry, it starts to hurt. I have a video on our website called the Estrogen Chat and IC. You need to go watch that video. It's in the video area over on the IC network, and that will explain a lot of it for you. Okay. So that's probably why you're using the ice, because it feels hot down there, right?
Uh-huh.
Right. Okay. So again, the more consistent you are with the estrogen, the healthier your skin is going to be, and it's going to be able to produce mucus so that it doesn't feel hot anymore when you're peeing. Okay. So you go watch that chat, and I think that will help. Watch that video, and I think that'll help quite a bit. Okay.
Okay. My other question is that I'm the one who has the involuntary movement disorder in my right ankle and foot.
Okay.
Jaw. You can tell I'm moving my jaw too much right now, and I lost a lot of teeth from it.
Yeah. Is it an essential tremor, or is it in a?
No, it's a rare disease caused by 3 medications I was taking with rare side effects of involuntary movement.
Okay. Okay. There was a, yeah. Okay.
And it became worsened in 2013 when I had, in March, when I had very, very, very close people in my life pass away unexpectedly
Okay.
in an 8-day period of time. And in the middle of that, I sprained my right ankle really badly.
Okay.
And one of the people was my mother, my dear mom.
I'm so sorry.
Whom I was living with at the time.
I'm so sorry. That's hard.
The other one was my pastor.
Oh.
So I had no one to talk to about my mom.
Yeah.
And the Grace Hospice people were very rude to me for some strange reason. They just had a problem because I was so overwhelmed. It was unreal.
Yeah. Yeah.
Being there were 3 people.
Yeah. That's so hard.
But what ended up happening was that about approximately a month later, I went to the physical therapy
Yeah.
evaluation.
Okay.
And, for my ankle. And I was, trying to do what the therapist told me to.
Okay.
And she looked at me kind of strangely and said, "Jennifer, I'm having a really hard time completing your evaluation because your foot and ankle are moving around so much." And since then, they've become a whole lot worse. And that at that point, I did not even notice.
Okay. Okay.
But several months later, after having to give away 3 kitty cats and find a new place to live, I ended up finding out that I needed to use a walker.
Yeah. Yeah.
Because at that point my ankle was actually beginning to spin in circles.
Wow. Wow. So
Yeah.
I don't have any information that would link that to IC at all.
I'm wondering.
Although it certainly could affect your pelvic floor if you're not walking normally.
Well, I know I have a leather brace that probably makes my legs different than each other.
Yeah. Oh, okay. Well,
One's probably higher than the other one.
right, right. Oh, honey, I wish I had more information. I wish I could help you with that. This is completely out of my knowledge set and my skill set.
No, it's about the same for everybody else. I even went up to Mayo Clinic in 2017.
Yeah.
All my paperwork, and not even that specialist knew anything else to do help my pain, which I was totally positively.
If you
amazed.
could, so I will make you this offer. If we could write up your case notes a little bit and really try to describe your pain along with the other thing, I would be happy to send it to some top IC doctors to see if they can give us a little bit of context here. But for us to do that, yeah, I need to be on the phone with you so that we can write it up together, because I love sending them, and they like hearing from me. They like hearing interesting and unusual cases from me, and yours is a very, very interesting and unusual case.
I'm definitely rare.
Yeah, yeah. And so if we could do this, if you could give me let me look at my calendar here for this week. I know that I am, let's see here. So Tuesday afternoon after like 1:00 Pacific time, so I'm available later in the days next week.
I'm in Wisconsin.
Okay, well, I'm in California, so later for you. You got to remember it's California time. So please, tomorrow's my day off, but if we could talk on Tuesday, Wednesday, Thursday, or Friday, I'd love to try to get a little bit more information from you and see if we can get some resources for you. Okay, hon?
Okay.
All right.
Will that cost me anything?
No, not at all. Absolutely not at all. I just love to just talk to you, and let's see if we learn a little bit more about it. And then if there's some questions that I can send off to some doctors, I'm more than happy to do that for you. You know, guys, for everybody listening and watching, the IC Network has always been free. There's nothing in our website and our support services that we've ever charged for. The only thing that I say is that if somebody wants to spend a lot of time with me going over their entire history, then I will ask them to sign up for a coaching. But I shouldn't say this, but I'm going to say this, guys. Like, seriously, you can call, and if I answer the phone, you've got me, and I would never charge. So it's just, the only thing is that people who sign up for coaching get first dibs, right? Otherwise, it's first come, first serve. So, all right, Jennifer, listen, it was great to meet you. It was nice to talk with you, and let's see what we can do to get more info, okay?
Where do I find the phone number?
It's right on the top of our Facebook page. It's right on the top of our website, 800-928-7496. Okay?
I'll find that.
All right, Jennifer. I will look forward to talking with you again.
Thank you.
Okay, Sierra.
Thank you.
You're very welcome, my dear. Hello, Sierra. We missed you last week. Sierra, are you there?
Yes, I am.
Okay, girl. How are you doing today?
Fine.
Awesome. That's what I like to hear. What can I help you with?
Yeah, is coughing flare up IC?
Can coffee flare up IC?
Coughing, like you have a bad.
Oh, coughing.
Yes, ma'am.
Well, yeah, because you're tightening your pelvic floor muscles every time you cough. Yes.
Yes, because tomorrow I had my coughing started July 17th.
Okay.
And I went back and forth to the emergency room, and they told me that I needed to see allergist for that, and I went to my allergist, and she referred me to a bust and swallowing doctor. So I'm going to see them tomorrow.
What kind of doctor again?
Automonologist.
Oh, a ruminologist?
Automonologist. Automologist.
Okay. Somebody who deals with autoimmune disorders?
Yeah. No. Ear, nose, and throat.
Oh, okay. And okay, so an ear, okay, got it. Okay, so
Yes.
it's great that you're going. Know that allergies can absolutely trigger more bladder irritation, but
Yeah.
coughing is not going to trigger bladder inflammation. But what coughing is going to do is every time you cough, you tighten your pelvic floor muscles, and you're going to end up probably with a bit of pelvic floor tension. So if it's not COVID, then it sounds like you actually might have a little bit of asthma. And
I have asthma. I was
okay.
born with asthma.
And so are you using an inhaler?
Yes.
Okay. Okay. Well, let's see what they have to say tomorrow. But you certainly could have a flare if you're coughing a lot. So you got to do a lot of relaxation. Take a nice, slow, deep breath. Try to relax your body. Okay.
Okay, and I'm also taking pelvic floor physical therapy too for my IC.
Say that again. You're doing what?
Pelvic floor physical therapy.
Perfect. Then that's
Yes.
great. That's great. Then they will help you through that. So that's perfect, my dear. Absolutely perfect. Okay.
Okay. Yes, and I'm also on estrogen.
Yeah.
And I would like to know, do you know anything else I can take? Because when I was on estrogen, I used to get like knots into my arm, but it was benign, so I got off them. So do you know anything else that I can take?
Well, was that oral estrogen or was that an estrogen cream?
It's a pill.
So when you take a pill, it lands in your stomach, it gets dissolved in your stomach, and it goes into your bloodstream where it's circulated throughout your body. And that's why oral estrogen is known for being more risky for things like cancer and stuff.
Okay.
Topical estrogen, like an estrogen cream that you can put on your vulva or in your vagina, tends to stay in that area and help that skin. And so it may be that topical estrogen might be a better choice for you because it's not necessarily going to get here in a big quantity, but that's something you're going to have to talk to your gynecologist about, because there might be, again, I'm not a doctor. I can't give you advice. All I can tell you is there are different ways of getting estrogen. Oral estrogen, more side effects. Topical estrogen, far fewer side effects, and it's considered more safe. Okay.
Okay, and would that help with the menopause too, the cream?
Yes, that's why you do it, because of menopause.
Oh, okay. I did not know that they had a cream out.
Yeah,
Okay.
yeah, the topical estrogen cream. On our website, we have a video of the estrogen chat. You should go watch that video, okay?
Okay. Do you know the name of the cream?
It's just an estrogen cream or an estradiol cream. There are different brand names: Estrace, Premarin.
Okay.
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 All right, hon.
Okay.
Okay.
Okay. Thank you.
All right, you guys, I'm going to shut this down. I will see everybody on Zoom later. Thank you for coming in. We're coming back to YouTube and Facebook right now. Okay. Let's move that here. We all have such interesting stories, right? There's such interesting stories. All right, here, hold on a second. Let me shut that down. Let me shut that down. All right, now I know you guys over on Facebook, you were having a little bit of a kerfuffle about something, and I'm not quite sure what it was. Let me see if I can, kerfuffles in the best possible way. Lorraine said, does COVID cause a swelly belly? No. It's me eating cinnamon rolls because of the stress of COVID. It caused me to gain an inch or two on my stomach. All right, I need to go back here. I want to look at this because y'all got into some sort of little disagreement here, and I want to try to understand what happened. So Aaron says, can you talk about IC and bladder cancer? So I think I did that. The bladder cancer, the cool thing about bladder cancer is that it's actually one of the easiest cancers to treat as long as it hasn't gotten into the muscle of the bladder. If it's just in the skin of the bladder, the urothelial layer, they've got something called BCG to treat it, infusions, and it's usually bladder cancer, again, is considered one of the easier ones to treat. Anne says, is Hunter's lesions bladder wall driven? Hunter's lesions is its own unique subtype. Can you get a flare with OAB? Of course. If you drink soda or coffee, you're triggering those nerves. You're going to get a flare. Denise says, what do you do for tile-off cysts? You've heard the surgery can be iffy. You're going to have to Google it. It's in this book, Facing Pelvic Pain. I'm not a tile-off cyst expert. Hold on a sec here. So we're going back to Evie. So Evie's 36 years old. She's got lots and lots of pain and muscle. See, I can't scroll back further. Darn it. Your physical therapist literally gave up on you. She says there's nothing else we can do. So remember what I said is anytime your muscles continue to stay tight and they're not responding to therapy, we always have to take a step back and look at bony structures. Remember the research study last year, which found that 70% of the men who had pain in their testicles had an underlying orthopedic hip abnormality. So we've taken a big step back of thinking about pelvic pain as being organ driven. That actually, for a lot of people, it's muscle, nerve, and bone driven. And your bladder is just the victim of another dysfunction happening. Your bladder is secondary. There's an underlying issue for many people, like a broken tailbone out of position, that's causing this ripple effect of, muscle tension. Then we've got ischemia. Then we've got the bladder wall starting to break down because of the ischemia. Then we've got bladder wall sensitivity. And of course, you don't understand. You don't know that there's muscle stuff going on. Your first symptom is frequency urgency. You call the doctor. Hey, doc, I think I have an infection. The doctor goes, all right, let's give you some antibiotics. You take them. They don't work. You go back to the doctor. The doctor does a culture. The culture comes back negative, but the doctor might give you antibiotics anyway, which I think is really tragic. Then that doesn't work. So then your doctor will suggest maybe you've got overactive bladder and give you overactive bladder meds, or say that you've got prostatitis and give you prostate meds. Ultimately, they don't work. And then at some point in time, you have the IC discussion. Oh, man, Jill, I hate to break it to you. I think you got this incurable bladder disease called interstitial cystitis. Here's the diet. Here's Elmeron. I'll see you in 6 months. And you're like going, what? What? Incurable? What? But you're a good patient. You want to get better. You want to sleep at night. So you follow the diet. You take the Elmeron. You do whatever the doctor says to do. You do the instills. 6 months later, a year later, 2 years later, 5 years later, 10 years later, are you better? The answer for a lot of you is no. And the reason why is because your problem might be beyond the bladder. It, in all likelihood, could relate to muscles. It could relate to tight muscles. If you've got vaginismus, if you've had muscles so tight that you've dreaded going to the OBGYN because you know inserting that speculum is going to hurt, or if sex is always painful for you as a woman, you have had a long-term muscle issue that eventually started to involve everything else. Now you've got IC, now you've got vulvodynia, now you got IBS, your perineum is on fire, all because the muscles above the skin are completely messed up. And we knew in 2008 that pelvic floor physical therapy was remarkably successful at reducing the symptoms of IC, more successful than bladder therapies. And that was the moment the IC world went, uh-oh, maybe IC just isn't a bladder disease. Maybe there's some muscle stuff going on here. And that is why now at every single diagnostic appointment for new patients, the first thing they would do is check your muscles. Because if it is your muscles, we want to get you to pelvic floor physical therapy because it works and you could be cured. And that's what Dr. Payne said in his IC subtyping system. It was such a crime that patients are told that this is incurable, when in some cases, depending upon your subtype, it could be completely curable. IC is a grab bag diagnosis. It really doesn't mean anything anymore. It's kind of like this mysterious, vague bladder disease. You need a more narrow diagnosis. That's why subtyping matters. Is it the bladder wall or is it beyond the bladder? Those are the two core things that everybody agrees on. Is it Hunner's lesions? Everybody agrees that's its own unique disease. That is a real disease. We now think that that's a viral infection in some patients, but it might also be nerves that are very, very inflamed in other patients. If you've got bladder wall-driven symptoms, now we have to figure out what the hell is triggering your bladder wall. Is it chemical irritation from drinking 6 Mountain Dews a day? Easy peasy, it could be. It would be. Is it chemotherapy? Is it using ketamine? The bladder is not impervious. It can be hurt. Okay? It could also be chronic infection. It's possible. It's absolutely possible. You could have a chronic fungal infection. You could have a chronic bacterial infection. You could have a chronic viral infection. But we can't say everybody has chronic infection because it's just not true. It's just not true. But there's a small subset who could have chronic infection. IC subtype 3, pelvic floor driven, is, in my opinion, the biggest subtype by far. By far. These are the patients whose symptoms began after some sort of muscle trauma, having a baby, a car accident, a fall, a rape, a history of athletics, ballet. God forbid you did ballet for 5 or 10 years. Your pelvic floor's toast. Football. Like I said, I've worked with professional football players. I've worked with Hawaii Ironman athletes. They spend years on bladder and prostate stuff. Doesn't work because underneath it all, it's their muscles. IC subtype 4, pudendal neuralgia. That's a nerve that's being compromised. If you've got sciatica, if you've got pins and needles, if you've got positional pain, it hurts when you sit down, but it gets better when you stand up. If you have persistent genital arousal disorder where you feel slightly aroused, but it's painful and it's disgusting and creepy and you don't want to tell anybody about it, that's pudendal neuralgia. What are we going to do? We're going to figure out where the nerve is messed up, and we're usually by a tight muscle. Sciatica is always piriformis muscle, usually. And then we're also going to try to calm those nerves down, probably with some lidocaine cream, maybe some nerve blocks, maybe some gabapentin, something that will try to stabilize those nerves. Then IC subtype 5, or bladder pain syndrome subtype 5 actually, is central sensitization, chronic overlapping pain conditions. That is a central nervous system issue. That is not a bladder-specific issue. People with central sensitization, and I'm a banner central sensitization person. Hello, redhead. We have very sensitive nerves, especially in our skin. We have a wicked sense of smell. We can smell things that other people can't smell. Smells drive us crazy. We have IC, we have IBS, we have vulvodynia, we have TMJ, we got fibro. And what's so interesting about central sensitization in this is that in the pediatric, so inheritance plays a role. Inheritance absolutely plays a role. Hello, I'm a redhead. Every woman in my family, wicked sensitive skin. But we also know that trauma can play a role, as well as abuse and bullying, right? And as asking, is Hunner's lesion bladder wall driven? Hunner's lesion is Hunner's lesion disease. It happens to be on the bladder wall, so we could say it's bladder wall driven, but it doesn't fit in the bladder wall subtype. What makes Hunner's lesions different is that there's massive inflammation, massive inflammation in the middle of the lesion that is not present in people with chemical chemo-induced cystitis or in estrogen atrophy. And that is why Hunner's lesion is considered a lesion-specific, its own disease, Hunner's lesion disease. And I'm happy to take any question from anybody, bladder cancer. We have some IC patients who have dealt with bladder cancer. That's completely on the table. Jennifer says, if we get cystectomies, can we eat or drink the forbidden foods? Yes, probably. I'm thinking of my friend up in Canada who had one 2 years ago, and she can eat anything she wants to eat now. But the recovery is a real beast. I mean, it's a year-long recovery. I mean, it's a really hard surgery to go through. Lorraine again said, after cystectomy, can we eat lasagna, tomato sauce? And the answer is yeah, usually. If you're bladder wall driven and we remove the bladder. I mean, the thing with cystectomy is sometimes they will build you an artificial bladder using some intestinal tissue. They take a section of your intestine and kind of create it into a pouch, and they have your ureter drain into the pouch. And then you use a catheter to drain the pouch, as compared to just attaching the ureters to a stoma and draining it directly into a bag on the outside of your skin. The thing about the using that intestinal bag is that intestine was never meant to hold urine. And so it can become very irritated and infected. So in that respect, if I were to have if I were to guess somebody with an artificial bladder in that way might react to some foods. I don't know. I would guess they would. Bethany says, typically, how long does it take for PEA to start working to calm nerve pain? I have very sensitive smell with headaches. If I eat spicy foods, it burns my eustachian tubes in my ears and, of course, my bladder. I have a very limited diet to foods irritating my bladder. I also have very sensitive skin and sunburn easily with sunscreen. I'm IC subtype 5 as well. I'm wonder PR is something. Well, hun, it has helped. It has helped me tremendously. I no longer have the pins and needles in my skin like I used to. And it would be an interesting experiment, and I would be happy to give you the scientific name and point you to some of the research studies so that you can research it on your own and look at those research studies. But I think it's exciting that we now have PEA as something that can be added to our normal routine that was designed specifically to try to calm some of those nerves down. Evie says, so hot and burning sensation like that with urinating is because of low estrogen? Yes. Yes. We call that urine burn. If your urine feels hot as you're peeing it out, that speaks to the health of your skin on your vulva. And that usually means that you've got estrogen atrophy and dryness on your vulva. And so the heat, direct reflection of the quality and health of your skin. And so using topical estrogen on your vulva to try to help rebuild that mucosal barrier is considered vital. You can also do something like coconut oil, which might give you a little bit of an extra barrier, but it's not going to fix it. Where if you give that skin estrogen, that skin can at least start to produce mucus. Lauren says, can estrogen cream be used in conjunction with low estrogen birth control? I don't know. You have to ask your gynecologist. Lauren says, I cannot find an IC specialist in New Jersey. They all claim on their website that they treat IC, but their treatments are all the same, medication after medication after medication. So you can check our database, and I can go through. Let me pull up the Harvard database here, and we can start. All right, let me see who they have in New Jersey. I have it open right here. All right, New Jersey. Ooh. For urologists, you got New Jersey Urology and Mount Laurel. They're focused on pelvic floor disorders and prostate health. You've got they're all. It's just New Jersey Urology. Offices in Mount Laurel, Sewell, Voorhees, Bordentown, and Willingboro, New Jersey. So New Jersey Urology. There's some physiatrists in New Jersey. They're the ones that would help you with muscles and bones. And then there are lots of physical therapists too, if that's what you're looking for. Lorraine says, how about getting dumped by your high school sweetheart, being forced to move out and being abandoned? Hey, man, we have our stories. We all have our stories. I feel your pain. I broke up with the man I thought I was going to marry on Valentine's Day. He said, what did he say to me? He said, don't get your hopes up. Dude, what? We've been together for 2 years. In the end, I dodged a bullet because he now looks like Boss Hogg. Yeah, I dodged a bullet there. So the Lord works in mysterious ways. When one door closes, always assume a window opens. There was a very interesting, I'm most active. I'm not really on Facebook hardly at all, other than when I stream. I mean, it's just such a hostile environment sometimes with all the politics. It breaks my heart. And so I'm usually on Twitter just a little bit, but it still breaks social networking right now. It just breaks my heart anyway. It's just so sad what's going on. There was a doctor who was suddenly fired, literally for no reason. She was stunned, heartbroken. She had just done this huge program for the university she was at, extremely successful, and just out of the blue, for no reason, they fired her, and they refused to tell her why. She has no idea to this day why it happened. It was like 10 months ago. And she's so angry. She's so angry about it. And I understand that. I got fired from my IC from my job. I was working, this was when I was working for a nonprofit, and I was doing fund development for them. And it was my happy job before I went on for my PhD. I was taking a year or two before I started the PhD. And I got fired when I was out on disability. The two of us who were out on disability, we got fired. And I was furious. So the first thing I did, because I'm not an idiot here, I already knew a little bit of the law, is I filed a grievance and said, you can't fire me because I'm out on disability leave. That is against the Americans with Disabilities Act. They refused to hear my grievance. And they also instructed every staff member not to talk to me. So I lost my entire support system. And this was when I was waiting to have surgery because I still thought my IC was possibly cancer. Cruelty, absolute cruelty. Then, because they refused to hear my grievance, I filed in California the Fair Employment and Housing. And that's a whole nother story. And then that I also filed with the feds. Because when I did my research, I found that the company that I worked for had done this before. They had done this before. That was their pattern. They fired anybody who went out on disability, pretty much, or at least a few, because I found other court cases against them. Well, I was in deposition longer than OJ. I was in deposition for 3 years. They used to fly attorneys out from New York to depose me. And one of them said, don't you think the reason you've got to use the bathroom is because you just drink way too much water? I had my glass of water and I said, sir, if you look at this, you will notice that I am sipping water. I have not drunk this glass of water in 3 hours. The only reason why I'm drinking that water is because I have dry mouth from the medication that they've given me for this. It cost my family $85,000 in legal fees to do. And this was still, the attorney was still on contingency, you know, or whatever the hell you call it. I got down to the last, we ran out of money. So I was 36, met with the attorney, said, this is it. We got nothing else. Trial was like 3 months away. I got $10,000. Can you get us through trial? He goes, absolutely. I said, please put it in writing. He put it in writing. He said, I can absolutely get you through trial for $10,000. A week later, I had a bill for $40,000. Like, what the F? Wait a second. I have a letter from you right now saying you can do this for $10,000. You have the audacity to give me a bill for $40,000. What the right? Then one of his employees calls me. It was like a deep throat moment. Go to the bankruptcy office, Jill. I'm like, what? Go to the federal bankruptcy office. Okay. Go to the federal bankruptcy office. My effing attorney had filed bankruptcy. He told me I had $1 million case. You want to know what he valued my case at to the bankruptcy court? Nothing. Nothing. He was living off of his clients. I fired him. I got a judge to look at the agreement. The judge said, this is ridiculous. He's written an agreement so complex, even I can barely study it. Fire his ass. I fired his ass. I get another attorney. The attorney goes, okay, I can do this. 3 months, we can get you through. I'm not going to charge you a penny. A week before trial, the second attorney calls me, hey, I've just been appointed a judge. I can't take your case to trial. I'm sorry. You need to find another attorney a week before trial. I'm like, what the F? And I nailed him. I said, no. You settle this case. If you can't get me to trial, you settle this case. Settled the case for $85,000. $75,000 went to my parents. Oh, and the first attorney filed a lien on the settlement. The first attorney got $8,000 or $6,000, however much out of that. So if the first attorney, with all the financial misconduct, with all the freaking bankruptcy, held back the payment. So he got his share. The other attorney didn't take anything. My mom and dad loaned me the $75,000 or whatever. All my savings were gone. Paid them back. Would you like to know what I got after 5 years of a lawsuit? A printer. A printer. That's all I got. I got like $500. I bought a printer so I could do IC stuff. And so when people ask me now about, oh, okay. Oh, so it gets better. So like it gets better. So like I'm still steamed. I'm steamed over this attorney declaring bankruptcy. So I go to my local congressman. No, I didn't do that. I went to the Bar Association and I went, guys, isn't an attorney required to inform their clients when they go into bankruptcy? And they went, no, we don't have a law for that. I said, all right, let's write the law. We wrote the law. I wrote a law. It went to my state rep. State rep went, this is great. Let's do it. You want to know who opposed me in the law? The Beverly Hills Law Association. They got my law tanked. The one time I would have actually had a law. and the Beverly Hills attorney group, whoever the hell they were, they blocked it. So I did get a little sweet revenge because it didn't work. Going to the Bar Association. Oh, and so anyway, I filed the complaint with the Bar Association also. And I gave them the letter. Here is his letter. He said he could do this for $10,000. He has given me a bill for $40,000. Surely his word must mean something. It took them a year and a half. They settled in his favor. They said he was trying to represent you to the best of ability, therefore he could charge whatever he wanted, and I lost. Okay. Here's my takeaway about this, is that shit happens, and sometimes the Lord has other plans. And when I really think about it, I hated that job. I hated that employer. And I'm like thinking, why did I give them 5 years of my time and my emotions and my energy fighting for a job for an employer I had no respect for? And so when people ask me now if they should fight, I say no. Don't waste 5 years of your life. If they're that reprehensible that they fire you because you have IC, walk away. Get a letter of recommendation. Thank you. It was a pleasure working for you. Walk away and look for something better. Because, and this is what I said to this doctor who got fired. I said, listen, the Lord has plans. There is something better for you. There is something that you are meant to do that would never have happened in that job. And I would not have started the IC network if I had not been fired. And the IC network has been the gift of my life. This is the work that I was always meant to do, in my opinion. I love the work that I do. Joel Osteen, who I like to listen to every now and then, he said, don't be bitter about the people who oppose you. Don't get consumed by the anger and relive it over and over again. Thank them, because you know what happens is you rise. You work harder than you've ever worked before because you are determined to prove them wrong. And if you didn't have that motivation to rise and kick in gear and look for something better and to work harder, you might not have succeeded. You might not have succeeded. So, you know, I accomplished what I wanted to do. I got a track record. They have a federal track record. They have a state track record. They have a local track record, and they have my lawsuit. So I was able to document discrimination in 5 ways. But at the end of that 5-year process, I was depressed, I was anxious, I was despondent, and there were moments when I just didn't want to be here because of the stress. And so it's okay to walk away from people who mistreat you. It's okay. Have faith. Sometimes there's something more important that is meant to be done, but it hurts. That's the only time in my life I've been fired, and it shocked me to my core. But it doesn't say anything about me. It says everything about them. And that's the thing. You got to remember, your IC says nothing about you because you're not your IC. You know, you are a person underneath that. And if somebody mistreats you because of IC, it has nothing to do with you. It has everything to do with their ethics, their conscience, the type of people they are. And it's disgraceful. And F them. F them. So no, it's 28 years later, and I'm not angry about it anymore. I finally have a little bit of gratitude. I finally realize, you know what? It's okay. I needed that. You know, if you bring something to me, I'm going to try to get better. I'm not going to give up. I'm not going to turn away in shame. I'm going to try to fix it and get better. And that's what I want you to do too, right? To God, to glory says, yet walk and never look back. Don't park at your pain. Amen. That's true. That's very, very true. Did they have something to hide? Oh, hell yeah, they had something to hide. No doubt about it. Boy, did I find a loophole in legal, in the responsibilities of attorneys, because seriously, any attorney who declares bankruptcy should inform their clients. And now, you know, I work with another law firm now, although very, very rarely. That's like the first thing I check. You got it right, Laura. You got it right. I know. I want to write. I mean, it's been a very interesting life, that's for sure. All right, guys. Well, listen. Last call for questions. Last call for questions. You got me. I'm happy to take any more questions you have. Any more questions? Any more questions about IC? Now, remember how I started the meeting. For those of you who are late, let me just kind of summarize. So we now have a newly issued diet for overactive bladder that happens to be pretty identical to the IC diet, like duh. And then we also have now we have very clear documentation that patients who get COVID have the potential of developing COVID-associated cystitis, CAC. Not everybody does, but for some people who do, those are for the people who have more severe COVID, who end up in the hospital and they've got the cytokine storm going on. For those patients, what happens is that the human body does a massive immunological response, and it releases things like cytokines that damage tissues. So there's a lot of cytokine inflammatory damage in the lungs, and it turns out that's also apparently happening in the bladder in some patients. So research studies show that patients who had no history of cystitis end up with COVID cystitis, and for long haulers, it becomes a chronic inflammatory condition. And so we're working on that now. We definitely need to have a protocol for those patients, and I'm going to be building a website on it. Still haven't done it yet. Been super, super busy. And then for those gentlemen in your life who are saying that they shouldn't get the vaccine, I will tell you of a study that just passed my desk this morning. It was about men who have had COVID who then developed erectile dysfunction. And as they were trying to treat the erectile dysfunction, what did they find? But active COVID virus in the gentleman's penis. Even after they're healed of COVID, there's still live virus down below. And we know that an erection is all about blood supply, and we know that COVID attacks the circulatory system, causes blood clots potentially, and it would reduce blood flow. So if you've got any gentlemen in your life who are saying, hey, I'm not going to get that vaccine, you're going to say, well, guess what? You might never be able to have an erection again if you get acute COVID. I mean, that's an exaggeration, but we do have a published study on that now. So that might be one motivating factor for a gentleman to think about that a little bit more. All right. Any more questions? Any more questions? I love hanging out with you guys. All righty. Well, then I guess we're done. Here's your homework for 15 minutes a day. I need you to do something that will ease your spirit, whatever that would be. Go sit outside in the sun, listen to whatever you'd like to listen to, something that will give you peace in your spirit and your soul. And God knows we all need that right now. For 15 minutes a day, I want you to do something for your pelvic floor or your bladder. Get down, come on, put on your yoga gear, get down on your floor and do your stretches, which I have not done yet today. For 15 minutes a day, I need you to do something for your noggin. Come on now, get your knowledge level up here. I mean, if you've never heard of estrogen atrophy, for God's sake, you need to read up about it, because women, we're all going to go through it together. And a great way to do that is with our new book, IC 101. It's not just a bladder disease. You can get it for $9.99 in our store. It's a PDF file. Having big time trouble getting it on Amazon. It's a number problem. Not accepting the ISBN number. It's weird. Even though the ISBN issuers say it's working, Amazon says not working. Anyway, it's a whole nother story. Then last but not least, for 15 minutes a day, or preferably an hour a day or more, I need you to laugh, because laughter modulates pain. Laughter modulates pain. A pain accompanied by anxiety and tears will be intensified by the brain because your brain thinks your life is at stake. Pain that is accompanied by laughter will be minimized by the midbrain because your brain's going, well, hell, she's laughing. Therefore, there's not a saber-tooth tiger at the door. Therefore, we're not, they don't have to intensify the pain to get your attention, right? It will minimize the pain instead. And so, TikTok, although I have a love-hate relationship with TikTok, I delete it at least once a week, and then the next day I turn it back on. It's a time suck, like there's never been time sucks before, but it's so fascinating, watching something funny, listening to something funny, hanging out with your friends, getting on the phone, talking with people. Come on, we gotta life is not terrible because you've got, I see there are ways of bringing some of that joy back while we're trying to get healed, whatever the hell is triggering you, right? Because something has got you if you've got these symptoms. As always, you can reach the IC Network. You can reach me personally at our corporate number. It's on our website, on our Facebook page. First come, first serve. I work with patients every day, no charge. If you want to spend a lot of time talking, then I might have you sign up for coaching because you would get first priority, but most of the time it's free and I'm happy to do it, and my goal here is just to open some doors. When I give you a little bit more knowledge, give you a little bit more context and kick you in the butt and get you back to your doctors so that you can start confirming some of the information that I may have given you. Let's see what they find. But it's about opening our eyes here. Don't keep focusing on your bladder. We have to look beyond the bladder too, okay? All right, my friends, I will see you later. I wish you well. I'll see you next week or maybe on Thursday for a drop-in, although I'm doing something on Thursday. I don't remember what. Anyway, okay, I'll see you later.